Okay, I ran into her a little bit ago, so that's good. In the bathroom.
And Madam President, we are live.
Thank you. All right, the time is 5:02. I'm going to go ahead and call to order this special meeting of the Anchorage School Board. It is Monday, November 9th, 2020. In the boardroom, I have myself, President Elisa Vacalis, Board Member Star Marcette, Board Member Alicia Hildy, and Superintendent Dr. Dina Bishop, with a host of administrative staff. Online, I have Board Member Holloman, Board Member Donley, Board Member Mitchell, and Board Member Bellamy. We have all board members here present and ready to go. Next up is our flag salute. Alicia, if you would.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Before we begin, I would like to acknowledge with gratitude the Dena'ina people, past and present, who have lived on these lands since long before Anchorage was here. May we all be good stewards of these lands. Shannon. We want to welcome you to our special meeting and thank you for attending and supporting the work of the Anchorage School District and this board. The mission of the Anchorage School District is educating all students for success in life. The board thanks students, parents, teachers, staff, school business partners, and the entire community for your investment in our district with your time, your talent, and your tax dollars. Next up on the agenda is the approval of the agenda. Are there any board members that wish to make any changes? If there are no objections, the agenda is approved as written. So next up, I have the superintendent update, and I will go ahead and hand it over to Dr. Bishop.
Thank you, Madam President. We have just a brief series of information to share in regard to some of the questions for which we've been asking, have been asked rather. And wanted to share just really in the restart decision, as you know, recent information has come to light. So we're going to just share that information. Jennifer Petronis, our Chief of Nurses, is here to share that when we get there. But understanding a lot of questions have come in today in regard to, what's changed. And we're really going to hit those topics. But understanding that the decision being made is really about balancing lots of different pieces of information and data. And within today's update, I am going to share information about what's happening medically in our city, as well as really discuss students' needs, school needs, but also really touch base on the science. Some board members have asked and shared emails with me in regard to not liking, or can't we just go back to the matrix that was just so simple? And the reality is that COVID-19 and the decisions that surround it are not simple. They actually are complex. And not only are they complex, they're adaptive, which means that answers and easy answers are already established. There isn't an experience there. Something that is a technical problem is something that, even if it's hard, it actually has steps to follow to solve. When we talk about adaptive issues and adaptive problems, they're a little bit trickier than that. We really use the best information we have at the time to make decisions. And so we're going to review some of that science. Certainly, just recently, Member Marcette has shared some of that with me. Your national school boards provide you a great deal of research and up-to-date research in regard to COVID-19, schools, and children. So we're going to share that as well during this meeting. So I'll start with Jennifer Petronis, Director of Nursing Services here in ASD. Next slide, please.
So I'm just going to go over the CDC indicators for safe reopening of our schools, just to show you where we are today. So looking at this chart, this was updated today with today's current information. You can see that we're in the highest category in that first core indicator of the number of new cases per 100,000 people within the last 14 days. It's extremely high, which is in the highest category. You can also see in that second indicator that we have went up in the percent of positive cases in our community of COVID-19 tests. We are doing a lot of tests, but a lot of them are also coming back positive. We have changed the 5 key mitigation strategies to yellow or moderate risk because our state and our muni is taxed out for contact tracing. So we are not able to correctly implement contact tracing, but we're doing our best to partner with the muni to notify those close contacts and positive cases as we know about them. The next slide. For our secondary indicators, we have increased quite a bit from these 7 days compared to the previous 7 days by 31%. Looking at our hospital capacity, you can see that we're in the green. However, we have seen a significant increase in the number of COVID patients that are currently hospitalized. Today, we're at 64 in Anchorage, which is significantly high. And statewide, we're at 103. Even though we're in the green, there is staffing issues within our community for hospital workers because they are getting quarantined and isolated from events that are not in the hospital, but outside events. As you can see, the percentage of hospital inpatient COVID-19 patients is in the yellow, and the health department is putting us in the red category for the localized outbreak. So we are in the red in quite a few categories due to our community spread.
Okay, and again, what was shared with us specifically this weekend when we meet, we're, as many of you are, 7 days a week and really planning and preparing, is again, the ability to staff the beds at the hospitals. And I wanted to share that our ability to staff as well, our close contact number in our employees is growing. Meaning that not necessarily a person with COVID, but someone who lives with or was notified that they're a close contact of someone else. But wanted to share the broader sense of what it is about why we continue to say we need to be back in school. And it is in line with the science that has been established around COVID. So just sharing, this is from the World Health Organization. And previously at board meetings, I shared about the Center for Disease Control, and a board member was concerned about the trust in the CDC. So this is the World Organization who shared these recent data in regard to their schools across the country, as well as the world that have been back to school. So this is studying millions of children. In most infection cases reported in children, infection was acquired at home, and they continue to learn more about this as schools have reopened. So similar to what we found with our sports, as well as with our staff, COVID comes to us. And so we demonstrated that with our data, and it seems as that is broader to the experiences of others. In their study, they also, this is a summary of it, that more outbreaks were reported in, of course, secondary high school than primary elementary. And really that studies demonstrate that children under 10 years are less susceptible and less infectious than older ones. And we had been hearing that. In fact, the group with the largest are those, 18 to 25-year-olds. And as you decrease in age, that susceptibleness as well as the infection rate decreases. Specifically in school outbreaks, due to the data that they've been taking, and this is especially, this was also demonstrated in New York City in their study, it was more likely that the virus was introduced by an adult than it was a student. So the transmission of staff to staff in any kind of facility was more than any student, not only students infecting staff, but the one in New York City found that students weren't likely to infect their homes either. So it wasn't if the detection from school wasn't in that area. And basically they used testing to demonstrate that. But wanted to share the information that's coming at us from these different modeling that's been done. And one of the, while a factor, they really shared that schools closing should be one of the last resorts looked at in a community, in a state, and in a nation. And as we know, many of the nations around the world have, put in curfews, put in some other lockdown procedures, but left their schools open. But early modeling does suggest that closing schools reduce community transmission less than other social distancing interventions. So the other interventions that we have work much better than closing schools, especially given the importance of what schools do for children, for families, as well as our community. These are some other pieces of information, and this is from pediatrics, also recent. 90% of affected children were household contacts of affected adults. So it wasn't a contact in schools. And this is what we know, that implementing concurrent multiple mitigations is important in promoting and reinforcing behaviors that reduce COVID-19. That was one of the reasons why we were very, very, very strong on a mask must be worn. We are working and getting to that social distancing. We want that to happen. And if we can't, then we're using other mitigation techniques such as dividers and things like that. So really working to mitigate the spread in schools. One of the things that Dr. Zink always shares is that says, trust your PPE. In the hospitals, people come there with COVID. They go there with COVID. And our hospital folks use shields and masks. And certainly if that is what's desired by different people, we want to also help that happen to provide masks, shields, covering the eyes as well as the face. And this is just some more links and information about studies that will help us provide just confidence that there is a reason why we continue to look at opening schools. And while presently we understand that our medical professionals are in a bit of a crunch right now due to their availability to staff their hospitals, they have the beds, they have the room, it's just the ability to staff, and understanding that they're sharing that the infection and the close contacts is not relation to their work. It's more in relation to what happens outside of work. I believe that's why the city has asked us to wear masks in other public places more often, as well as with our own friends, even in our own homes, we can get back to the business of educating our community, educating our children. I want you to know we use these data, use the information, use the science to provide confidence in going back to school. We don't select these items from the blue. We don't think them up. I think I've been challenged that way. I don't know how many, either at this board, at this dais, or other places that I've asked about science. Where's the science? I wanted you to be able to know that we are quite guided, well guided with the science around COVID-19 and educating children. Our plans are standardized and they're very succinct. They are customized to schools. That was also a criticism about why do we have to do this at the school level? Well, because number one, we want to build confidence at that school level. We want to engage the stakeholders who are there every day to understand the mitigation techniques, to share in their ideas about what they think works best. Once you have the standard of, 6 feet or the standard of mask wearing, how is it at the local level, at that building level, we make those things come to fruition? It was good to know, and a reminder at a school, a teacher told me just the other day that young children, obviously they have spatial issues, they forget where they are, but even if we train them and teach them in the classroom what 6 foot looks like, immediately when they go outside, they forget those, what 6 foot looks like on the playground. And so what we found in our reading programs and other places is that we have to continue to reinforce that behavior on the playground. And then what does 6 foot like when we're waiting for the bus? And what does this look like? And that really it's a constant reminder to kids, but that they can learn and they will learn. And then what they do is they get on us when we slide back a little bit. They let us know what the rules are. And that really hit me, that teachers are really working in all those different categories. And that's why we need that voice at the local level. We continue to notice new ideas in PPE. And this weekend, some 150 more sets of dividers made out of the PVC were designed and delivered. As teachers share what they've come up with in one school, we'll share it with another school that perhaps didn't have that, and then also assist in creating those. And then, of course, training. We've noticed as well that we need that. Board members here have shared their instances in the school district as well as out of the school district with coming across people who aren't wearing a mask or having it open where their nose is. These are all practices that as a community, if we work together, we can be together in schools. And it isn't perfect, but we hope to get there and really support each other. It was not something I wanted to do, to postpone school. I know that it's necessary in our community to support our medical community in their efforts, as well as really our own efforts in being close contacts. We want to be sure that we don't spread the virus, but that doesn't take away the direction that I'll continue to face forward in getting kids back to school when we can. Thank you.
Thank you. Just a reminder to board members, this is, our opportunity to ask questions, whether they're the ones, we thought we were going to ask on Friday or the ones that, after last night, we are now asking. This is our time for discussion. First hand up in the queue is Board Member Hildy.
Thank you. And I just want to thank Dr. Bishop for your work. You've been very consistent saying you are working with our medical health professionals. There's been a lot of harsh words, I would say, but I appreciate your commitment to that. It's what you said you were going to do, and it's not the outcome that everybody wants or that people expected, perhaps, but you've said that's what you would do, and you have done that. So I appreciate that as a parent and board member. I just have one comment and then a question. There was a quick mention about a board member not trusting the CDC. I want to make sure we're clear that the professionals at the CDC are highly trained medical professionals, and it's totally appropriate to rely on their advice and recommendations. As Alaskans, we have the unique opportunity that one of our own is a deputy director of infectious disease at the CDC. So not only do we have somebody there who's worked in Native health, right? So he's there to advocate not only for Alaskans, given our unique infrastructure, transportation, and staffing needs, but Dr. Zeke has shared that she's able to call him and say, how does this CDC regulation apply to what you know about Alaska? So that is appropriate to rely on CDC guidelines. And if people have a question on that, I guess it's always appropriate to question, but I don't want us to get into the habit of denying medical advice. But my question is, one of the things that I've heard from teachers and a very minor number of parents is that when we do get kids back into the classroom, is it going to be this like oppressive, sterile environment with these mitigation strategies? I've heard really strong words on what school would be like, and that it's just going to be so miserable it's not even worth doing. So Dr. Bishop, could you give us some insight on what's happening around the country, what's happening in Anchorage already, and then what you and your team and the teachers who are already providing instruction, what they're seeing as far as, honestly, quality of life in addition to quality of education?
Sure. Well, that's a great question. And I could share that having 6 feet apart from you and wearing a mask all the time is oppressive. And so certainly it just, I guess, depends on what you would believe. And I don't believe it is. Is it changed? Is it different? Absolutely. Are there barriers between people? Absolutely. But as we go to grocery stores, there's barriers now between the checkout person myself. When I go to the bank, it's there. Our world has changed in a way that if you saw that mitigation techniques are oppressive, then perhaps that's what you look at. But I want to share that every day that a child goes to a classroom and works with a teacher, it's a good day and good things happen. And that's evidenced, part of our looking into this, Dr. Stock has looked to the south of us and the north of us in districts, and great things are happening every day, and they're sharing that. In our own classrooms, we have campfire going on, we have pods, we have reading classes going on. And there was trepidation at first, when we don't know much, and okay, we're doing all these mitigation techniques and kids are coming back. But hands down, in all of those programs, we have more and more teachers wanting to be back, wanting to do those classes. Those of us that went on the tours in our schools, there was excitement in with our teachers. There was excitement about just seeing kids again. I do not believe that teachers choose to be oppressive. And I think it's a state of mind more so than, if you define wearing a mask as being oppressive, then perhaps that's, how your definition is. But when I've been in our classrooms, when I talk to our teachers, it's amazing. And it's going to look different rules, but we've demonstrated that being back, good things happen. People are happy. Kids are happy. Teachers are happy when the kids come. They get to do the things that they love. So I haven't seen it, but certainly I would ask the board that the teachers that are teaching now with kids, please ask them if they believe that their classrooms are oppressive and not good for kids. I would say the opposite, that a teacher excited for a kid to be there and a kid excited to be there creates a pretty awesome thing.
Thank you. Next up is Board Member Holloman.
Yes, two things. One, I think we do need to explain to the public more often that if we ever are going to open, we have to plan to open. I know that a lot of people look back and they say, well, we said we were going to go back in August. We said we were going to go back in October. But the logistics of a school being open and ready take days at the very minimum, and better off weeks, just to be ready, to have schedules ready, to have food in the cafeteria, to have staff prepared for kids to walk through the door. And so I do realize that I think a very difficult part of the superintendent's job is you do have to put dates out there. You do have to set a target and say, this is what we're going for. And unfortunately, it's a situation in the community that keeps changing that has introduced the instability. But I know it's frustrating for staff. I know it's frustrating for the public. But I hope that we can communicate to them that we kind of have to do it. We'll never be able to just say, oh, Monday looks good. We're going to be ready for kids and have it work. It's always got to be a date out there 3 or 4 weeks. And then things will change. The other thing in your report to us that is concerning to me, and I think mainly because I do hear it a lot in the community, is the less than for a description of how contagious this is for young kids. And, a lot of people are touting the fact that 99% of people survive a COVID infection. And unfortunately, I think it minimizes the damage that can happen. It's not satisfactory for us that the number of kids that might get sick or infected or hurt by this is lower than 20-year-olds or 30-year-olds or 40-year-olds. It really does have to be talked about in terms of absolute numbers. The numbers in Alaska today, 20% of the new cases that were posted today were people 19 and under. I think about 5% of them, or maybe 4%, were under 10, and about 11 or 12% were between 10 and 19. But this is something that seems to be changing as well. I think a lot of the data is based on things that happened in the spring, where a lot of school districts did what we did. In essence, we closed down, we sent kids home. There's a lot of concern. Kids don't go to work, especially the ones under 10, the same way adults do. So it kind of makes sense to me that older people got sick more. But it seems like younger groups are starting to catch up. And the future of that is very concerning. So I do hope we will look at numbers in terms of how many thousands of elementary school students we have and what those percentages mean if that very small percentage of kids that will wind up picking it up at school, how many kids is that? Because that's really what we're getting at. We're not trying to just have a low percentage of kids get infected. We're trying to understand the actual numbers and what the damage is. And I do accept the fact that when we do go back, there's going to be risk, and we're going to have, unfortunately, despite our best efforts, I think there will be some transmission. We have to do our best to make it really small, but I do think we have to be accurate about what the numbers mean. Thank you.
I'll see if Jennifer Petronis wants to comment on the student cases, but it is noted that what you said is that sure, COVID is among us, and so our goal, like you said, is to mitigate its spread here. But again, these studies were of kids going back to school around the world, and really they share that the infection in the infections of COVID-19 cases reported in children, infection was acquired outside of the school. So they didn't find schools to be super vectors. I did follow up on a comment made in the assembly meeting in regard to Matsu. And so I had a conversation on Friday with their superintendent, and he shared that, if you need to, please share that they have not had any spread in their schools where masks were used. And of course, they do not require masks under third grade. And they said, he shared with me that the students do come to school as well as staff with COVID. They have full classes, full days. So they don't, they pre-K through 12, they're just regular school. And they do require masks from third grade on. And he did share that their cases, they've had 70 in their school of all those kids and adults. And any place that masks were enforced and used, they did not have any spread. The time that they had a spread in their classroom was unmasked, which is good evidence just nearby. So did you want to add anything, Jennifer?
Through the board president to Member Holloman, Dr. Bishop is absolutely correct. The same thing that she just stated is what we're finding in our schools, in our sports thus far. The majority of our cases are coming from adults getting it outside of school, such as at gatherings, dinners, and things like that, and then spreading it amongst themselves. And the sports cases where we did have transmission was also in unmasked cases before we were wearing masks indoors in all of our sports was where we saw the transmission.
Thank you. Next up in the queue is Board Member Mitchell.
Thank you. I had a question for Ms. Petronis. I know that when you went through the numbers, Dr. Bishop, you mentioned that there was issues with staffing the beds. So are the numbers in our matrix that we're using to guide our decision making, are those based on staffed beds or total beds?
Through the board president to Member Mitchell, those are based on total beds that are available in Anchorage and total beds that are taken by patients. And just because the beds are available doesn't necessarily mean they have the staff to have people in those beds.
So is there any way for us to reflect the more relevant number, which would staffed beds?
I do not have a way to get that number. The number that I pull is directly from the DHSS state website, which is where all hospitals are required to report the number of beds they have available in their hospital and the number of beds that are being occupied, but there is no difference between the number of beds they're able to staff.
Okay. And then I just wanted to follow up on Andy's, Member Holloman's comment. I will send that link to I've mentioned a couple of times the University of California, San Francisco did a study nationwide where they looked at children who were admitted to have procedures so as a result of having to be admitted to have these procedures, they had a COVID test done across the country. And they found that, I'm absolutely not disputing, the numbers of that spread within the school, but it was interesting that they found that those children had the same incidence of COVID as the general population in that area. So certainly children are getting it, and it is very likely, to your point, that is coming more from adults to children. But nonetheless, the kids do have it based on that study at the same type of rate that is in the general population of the area, which is high right now here.
Next up is Board Member Bellamy.
Yes, thank you, Madam President. So I have a couple of comments, and then I do have a couple of questions, maybe just one for now. But I do want to, I get the sense from, maybe it's just me, but I get the sense that there's a feeling that we don't want schools to open. And I can only speak for myself. I like the phased-in approach. That has never been my issue, never. So I want to go on the record to state very clearly that I am for getting kids back to school, and I am for a phased-in approach. What I've seen in the schools is remarkable. The things teachers have done and are willing to do blows my mind. My issues have to do with timing. So I do thank the superintendent for being courageous to say, this is what I planned, but this is the reality. And my other concern has to do with impact. The impact to vulnerable populations, to our poor family. And I know that I keep hearing that kids don't transmit it. But we know that they're little carriers, and they do carry things home, and they give it to their loved ones. So, and that brings me to my question. So how did we factor in, what was the conversation, or how did we factor in the potential impact to families who are very vulnerable? They don't have access to health care. They live in multi-generational homes. Those families who probably don't have any other option but to come back to school, if that is their only option, to come back to school or do ASD virtual. It seems to me. So I would like to have just a little of our thinking around how do we factor in those vulnerable populations who are our poor students, our Black students, our Indigenous students. How do we do that? And what was the balance in weighing those potential impacts?
Thank you for that question. So it looks different at different grade levels. All grade levels, however, have that choice, as you know. There is an at-home or an opt-in. So the choice remains for the comfort level of that home. We have shared information from Muldoon Elementary in a discussion about the students that are coming back. And they did share in their reading program that initially they really had to educate their families about the opportunities that are being provided. Because initially it was this, again, kind of not so sure they wanted to go. When they discussed with them, what they shared was what you had shared, a lack of access to healthcare in the home. And so if my child is sick, I just don't want to get sick at all, because then I can't go to school or we don't have healthcare. So some of the mitigating factors there are the same students that we've invited back are also experiencing this achievement or outcome gap, if you will, in learning outcomes. So what we see is the same families that might fear that are the same families that might just need it most. And this is shared by my colleagues in the Council of Great City Schools. Their suburbs are back at school. Their higher socioeconomic are back at school and desire to be back. We, again, have, seen that in our own data. So what we've done is, and I'll have Jen Petronas share some other pieces of information, but educated, certainly, gone out to communities that needed support but that weren't ready to come back. This is especially true in the Diamond area, where our ELL set up kind of a little minivan of support for education if they chose to stay home. For students that are coming back, and we really believe that that face-to-face is essential, especially in learning how to read, we've done a couple of things. Number one, we've expanded telehealth to 16 schools presently, to where services can be shared directly with a health provider. There isn't a problem with insurance. We're working through the Denali Kid Care and having our pediatricians in town waive some of those fees. So we have access to telehealth for parents. We've expanded our school-based health centers. We added, I believe, 3 more by Men's Health, where they have doctors as well as nurses do site visits at schools. So we're trying to wrap around those services. We worked with the Volunteers of America, and Assemblymember Zelatel, I think, shared this publicly. Through their CARES Act, they provided $1 million to Volunteers of America. We supported that because those mental health services were coming back to us, as well as other health services. In addition, 158 additional barriers were made for title schools, for classrooms that are being dispersed, to really create, that safer space, if you will. We also have Abbott ID Now, which I'm going to have Jen Petronas share. We're really targeting Title I schools for this, because we have found through the reading program that sometimes it's not even a parent not wanting to go get tested. Sometimes we don't have cars, and the kind of testing centers that we've set up in Anchorage are drive-through centers. If you don't have a car, it's hard to get a COVID test. Mm-hmm. So, Jen, would you share some of the actions that we've done in regard to the testing be available at school?
Absolutely. Through the board president to Member Bellamy, we have partnered with the state to get 28 Abbott ID Now rapid test machines and the supplies. We do plan to put those in the majority of our Title I schools in order to help bridge the gap of those who have the ability to drive to go get a test and those who do not. It is targeted mostly at students who do not have the capability to go to a doctor or to one of the many testing sites in Anchorage. We also partnered with the Emergency Operations Center of Anchorage, and they are also, through November and December, putting testing sites in our school parking lots twice a week. For example, Muldoon, Clark, East, North Star. So they will be places in parking lots where families can walk up to get tested, and that will be available to anyone in the community in those areas. So we are trying to just expand testing so that when school nurses send students home sick, their only option is not to just stay home for 10 days before they can return, but to get tested so that if they're negative, they can return the next day.
And really just stressing the importance of education. Even prior to COVID-19, we found a difference in the attendance in our lower socioeconomic areas and in the attendance of other areas around town. And primarily in certain student groups, there might have been more, especially our Polynesian, had Pacific Islanders, had one of the really for attendance reasons, we're very far off the mark and what we'd like to see. So it's really during this time as well, talking to them about the importance of education and going to school and succeeding, because we know that that is part of that. So just the general communication by the schools as well to be able to support that, in addition to those health concerns and really family concerns about COVID-19.
So just a quick follow-up, Madam Chair, if I might.
Yes, ma'am.
So Dr. Bishop, are the, well, whichever one of you, I'm sorry, Jennifer. So are these services available right now, this moment, to families?
Through the board president to Member Bellamy, the testing capability is not available at this moment. The Emergency Operations Center will have their first parking lot school site available on this Friday, the 13th at Muldoon, and then they'll have them twice a week at various schools throughout our community from then on until the new year, and then we'll relook at it. The Abbott ID Now test kits, we do have 2 available, but we have not started using them. We have to go through a training process to make sure that our nurses are prepared and ready to use those. But we will have them, everything up and running before students come back into the building.
Okay, thank you.
Next up in the queue is Board Member Marset.
So there we go. You know, I saw a lot of, I saw some, am I muted? Yes. Oh, I'm fine. Okay. I saw a lot of Facebook posts. I saw a video this last week, and one of my concerns is, and this kind of a comment, and then I'll ask my question, is the false information that's being put out there. And I actually pulled up our website, and I don't know what better plan you could put out there. I mean, I have looked at it intensively. It talks about what happens if there's a case in the school, if a staff becomes infected. I mean, I wish we could just pull it up right now and show people it's out there. We now have all the school plans also out there so that parents can see that. So when we say ASD doesn't have a plan, that is not correct. And I just want to say that there is a plan out there, and it's a plan that's been thought out thoroughly, been supported by the public health department. I had a chance to go out in the schools last week. I asked questions about the supplies, and in every classroom I saw supplies. The hand sanitizers that are supposed to be on the wall, they've got places for those to be installed, which will be installed this week. But as far as masks and other things that were needed, they were there. And I didn't hear one person say that they spent their money. And if they did spend their money, I heard the principal say that they would be reimbursed if that happened. And I know that Dr. Bishop has made that commitment also. So I'm just a little concerned with, you know, I would ask people, please ask the questions if you don't see the information out there. Verify your facts before you go out there and publish this on social media or wherever, so that the community is getting the right information and not just information that you think is correct. The other thing I wanted to say is that decision to go back to school. I felt as a board member that we have had as much time as we could possibly have, given that things change all the time. And I think our goal has always been to get kids back in school. Just as Member Bellamy stated, we do want kids back in school. And so I don't think that would be a surprise to anybody that that's what we're working for. You know, it's been pushed back again, but we will have another date, and people will have as much notice as we can give them. And this is not a perfect world. We're in this with so many other people, and to say you need a month's notice, that's probably just not going to happen. I mean, you need to be prepared at all times, because this is the goal of our district, to get kids back in school, and we'll do what we have to do that. The other thing I heard, that one of the reasons that that maybe we wouldn't start back up is staff not showing up. And I know this is not a popular topic. I know that people are afraid. I know they have concerns. But I'm going to say doctors, nurses, grocery store workers, they all have concerns too. And they don't have the option of saying, I'm not coming to work. So as a board member, I think we need to hold our staff accountable for coming to work when we need them. And I think that will probably get me enough emails that I should stop.
All right, I had my hand up next in the queue, so I'm going to go ahead and just take a quick opportunity. I guess just to follow up on Star's last point, in the email that was sent out to parents, it talked about the community medical capacity, as well as the increasing number of close contacts, which is significantly reducing our ability to staff schools. I understand there is some sort of an internal dashboard or a tracking system, to kind of track between staff and students, who has it and who doesn't, or maybe who's, been put into that, window of close contact quarantine or something like that. Do we have a breakout between union or type of staff to give us a mind's eye of where this is affecting us most? Is it teachers? Is it student nutrition? Is it bus drivers? Do we break it down that way on an internal basis to find out where those close contacts are really affecting the staffing that would significantly impact our operations?
That's a good question, Madam President. I'll turn it over to Tom Roth and Ollie, who really organized that. But we haven't done that. In fact, we could find out because we get reports, but really to keep privacy of our individual employees, we don't publish any of that information in regard to who they are and where they work. As we know, and it's in our training, there's a part of this COVID-19 that trying to stop shaming of people and all of that. And we don't want to have anyone fear coming forward and sharing information about it because they feel a bad negative repercussion from their peers would happen. So it's very private, although we keep the aggregate. I'm not so sure about the disaggregated information simply because of student and employee rights of privacy, but I'll turn it over.
So to the board president, yeah, Dr. Bishop's absolutely right. We could, when we receive reports, we know where they come from. So we could identify those organizations and the individuals where they come from, but generally speaking, we are not keeping track of that. And we're really just looking at the aggregate numbers and responding to the reports as they come in.
Thank you. And then my next question, because I'm allowing everybody to, before we keep cycling through. One of the things as a board member, I will always want to ask is what can the board do to help? We know we have our lane and our role and stuff like this, but what I want to know as a board member is how can we help? What are things we can do? We're here for policy and for budget and stuff like that. And I've got so many questions, one of them, potentially being a calendar, change. We get so many emails where people are talking about how things are going to increase over the holidays. What can we do as a board to look at options, to help our community overall, in terms of, mitigating spread over the holidays. So just looking, how do we help as a board?
That just reminded me specifically to that question. There has been a great deal of that. It's just, the idea gets worse before it gets better. So we did take a look that if we didn't have any movement of anything, what would that look like in our system? Not necessarily, as we know, closing schools down is not a huge mitigating factor in the spread of COVID, what they found. But if we were to have kind of a freeze on our calendar, Dr. Stock is with us and he looked with his staff, does the school calendar. And what were the days that you looked at, Dr. Stock, if we were to have any kind of a hold still and then add days to the end. Are you on Zoom?
I am, Dr.
Oh,
Bishop.
there you are.
This is Mark Stock, Deputy Superintendent, and through the board president and to the rest of the group as well. We did look at the calendar. The question was posed to us today: what would the calendar look like if we simply suspended education for this time and took a break and then reinstituted it? So there are 14 school days between the end of Thanksgiving break to the beginning of Christmas break. So there's 14 school days in between there. If those days were added to the end of the contract, the last teacher day would be June 11th and the last student day would be June 10th. And that was in response to a question that was posed to us today.
Thank you. And my understanding is that would be a board action because the calendar is a board approved document.
That's correct. And that came through in an email to the board and in regard to that. And calendar adjustments would be board approved and then, of course, sent to DEED to allow the Department of Education and Early Development. They do the final look at that because there's a certain amount of teacher days and a certain amount of in-service days, student days to constitute a full year to receive state funding.
Thank you. I'm going to go ahead and turn it back over to other board members and I'll just get back in the queue when I'm ready. Next up is board member Hildy.
Thank you. So I just wanted to touch on, what I've seen in the community, because we talk about community spread around children. This is my kids' age, right? This is my stage of life, these little ones running around. When they're not in school, they are not home practicing mitigation and social isolation. Like, I see what's out there. I mean, I don't put my kids into compromising situations, but maskless events, structured, because there has to be some care for children. So when they're not in school, it's not like the alternative to the idea that kids are getting COVID from each other. That's happening outside, right? But if you're in school, then you do have those structures. I can tell you as a little kid, like I learned smoking is bad in kindergarten. I went home and told my mom and put up signs and said, let's not do these things. And she stopped smoking, right? Those are things that children learn in school. Those change health outcomes for families. The mitigation I've seen in our classrooms is 10 times better than the mitigation strategies I've seen from like community children focused groups in our around town. So all those people are doing great jobs and they're trying very hard, but it just doesn't compare to what I've seen in our schools. It is superior mitigation strategies. And then we mentioned something, I represent all kids, all families in our district. That's what we do here, but there's no mystery that my heart is with the most vulnerable children and the ones who just don't meet their academic potential in our districts. So when we talk about vulnerable children, when we talk about them taking something home to their vulnerable parents, that goes against what we know about what happens in our classroom when we use appropriate mitigation. We do not have children giving COVID to other children when they are wearing masks. So those children are not then taking it home to their parents with vulnerable health. What I can tell you is that our disparity in educational outcomes is rapidly increasing, right? So before we were here, and the idea that now we're going to catch up, if we could have caught up, we would have done that before, right? I would hope we would say that. So the idea that somehow we're going to make this giant difference, and there are lifetime outcomes. There are public health outcomes related to that. Certainly we have, racial discrimination in healthcare and in government and, our criminal justice system. But the component I can control as a board member is the educational outcome of the kids, making sure they can access healthcare, making sure they can access appropriate remedies in our justice system. So that's the part of that I can control. And when we allow those disparities to grow, which is happening since March, right? Since March, almost, 8 months, that we have to own that, right? That's going to be a lifetime of consequences for those children. I love that some people don't have a whole slew of health risks in their family, that COVID is the most important thing. That's a win for a community, right? We want people to have income stability. We want them to have other health stability and health insurance stability. Those are great things. But for a lot of families in this community, gun violence, those are the people I work with each week I'm around that. these are real health crises too, that they have to balance all of those factors, and parents shouldn't be bullied or pressured in making those decisions for their children. And I'm hearing some of that, hearing some of it, parents who want to speak out to, their teachers, and the teachers praising parents who testified to the school board for saying close schools. And then the parent doesn't want to come testify. That's not appropriate. I've heard testimony of people bullying for making different choices. I let my kids watch Black Panther this weekend. That's like objectively not for little kids. There's a lot of violence in it. But as a mom, I make a personal choice for different reasons, because there's benefits to my children in watching that movie that maybe somebody else isn't going to have. And it doesn't really get us anywhere discussion-wise if we're just going to shut down conversation, use bombastic language or bullying behavior. These are really hard decisions. So I guess my appeal here is to the board to model it, and then to hold the people we talk to accountable for how we talk about these solutions. Everybody wants kids to get back into school. I've heard that from board members. I totally respect that, but what are we going to do to talk about that moving forward? So I hear Member Vacalis talking about a schedule change. I want to hear, what is the solution? How are we going to move forward in a way that, maximizes public health, but keeps children at the center?
Thank you. I really appreciate the conversation here. I do want to say that after we had a school come out and share their mitigation and their readiness for school, the teachers received negative feedback from their peers. We had another school request. We would love to show you our school, but we want to be sure that no one knows we're doing it. We don't want any media there. We had to have a reprimand with pictures that were taken in classrooms from other staff members and then sent to AEA and then published. Principals every day are trying to take care of their people. They love their schools. They love their teachers who feel ready, and they love their teachers who aren't. And our goal is to involve everyone in the conversation to bring them to a place that they can move forward and have their needs met. That is why schools look different, because the comfort level, their expertise, their knowledge, they're at different places. But the commitment from this board that could help me is that we talk more about how we're going to get schools open than all the reasons we can't. I haven't felt necessarily supported, and our principals have shared that with me as well. They feel left out on a limb for doing the things with their staff and children. And again, it is okay to have a feeling about COVID either way. But our responsibilities as employees is to address those, to come to terms with those, to ask the right questions about what we can and can't do based on our own families, and to take the necessary, whether it's employment, decisions or elsewhere to make that happen. We've been provided a great trust by our community to educate their children. We've been provided wealth by our community. Last year's budget was $574 million. Over $500 million to educate our youth. And I don't want for a reason for any educator to feel that when I use the term we're failing our children, that I mean teachers. That is not what I mean. We are a system and a community that should put children first. And I have been struggling to do that. Climbing a wall, climbing barriers all the time. I want to get kids back, and I'm going to get kids back. We should say we want it, and we're going to do it. If we wait for a number that I continue to be asked, why don't we just go back to the 30 number? Anchorage will not be back in school for 18 months, I would suppose. Even after a vaccine, building the herd immunity takes time. We we need to make a commitment and understand and trust the PPE, provide the shields and the masks, provide the techniques and the support to teachers so that if they choose to come back, they're in a place that they feel good about it, to feel good about being with their kids. And those that cannot, we also allow them choices with our flexibility. But I thank you for this conversation, because I'm glad we had it. And to Member Mitchell's point, it's she's been saying, let's have, the kind of conversation we need. So this is appreciative. Thank you.
Thank you. Next up in the queue is Board Member Donnelly.
Yeah, the reason we're not going to go back to the 30 standard is because it was a wrong standard. It was based on wrong data. It was based on a wrong, and Health and Social Services specifically said so, that matrix was not designed for schools. And we were using a matrix that was not designed for schools when we were using that 30 count number. They recommended against using it for schools. The new system that you adopted, Madam Superintendent, is vastly superior to that. I advocated for that probably for 4 or 5 months to get off that 30 standard, because it was erroneous and didn't comply with the World Health Organization guidelines or the CDC guidelines or the State Department of Health and Social Services guidelines. I'm much happier with the standards that you have developed, but you're absolutely right. I'm very disappointed we're not going back on the 16th. I think we need to go back. We need to go back as soon as possible. And I'm very disappointed we're not going back on the 16th, because all the data indicates that kids aren't catching COVID in schools. They're not passing it on. There's very, very few examples of instructors getting COVID from children nationally. And we need, as a community, to have our kids back in schools. So I'm very supportive of your efforts to get us back into schools as soon as possible, especially for our younger students and for our special needs students. That's just crucial. I also am concerned about the number of instructional days standard and how it's being measured. We do have state law that requires a certain number of instructional days. I'm still concerned that by not having direct instruction on Wednesdays, we're not going to meet that standard as it was intended by the legislature when it adopted those numbers, so the minimum requirements. So I'm looking forward to how we're going to address that in the future.
Dr. Stock, would you like to talk about those Wednesdays or just bring that back? I don't know if you've had those conversations.
I think we'll definitely have a conversation. There have been some discussion about the use of those days and whether, as this goes on, the original use of that had a lot to do with being able to give teachers training and time and pedagogy and to give them opportunities. It's quite possibly that we are now in a remote world where that can be re-examined, and I'm happy to take that to my team Wednesday morning and continue that discussion. It might be time for us to re-examine those.
Next up in the queue is Board Member Holloman.
Thank you. One thing I did want to say is I did find the plan, the ASD side of the plan for coming back pre-K through 2 to be very impressive. I do think we need time for the best ideas to circulate among all schools, and the intent to go back on the 16th certainly focused on that. Having looked in on a few classrooms, some are very much better prepared than others. Just some places either worked on it longer or they just had better ideas about it, and I do hope those get around. But I will say the one part that's confusing to me, and I think also when we look at some of the data that talks about the low incidence in schools, is those were in settings where transmission in the community was under control. And the concern over the past 4 weeks has not been so much about whether or not ASD was ready or could do what it needed to do, but what the situation in the community. And compared to where we were at the middle of summer, we're out of control, and we don't, and I'm speaking as Anchorage, not as the Anchorage School District, and no particular idea of how soon we're going to be under control. This hasn't peaked yet, and we don't know where we're going to peak at. It obviously will peak at some point and begin to come back down. So that's, I think, when we can start to look. But all this COVID that's in the community right now means there will be more COVID in our schools. There will be more staff members that show up before they realize they're contagious. There will be more kids sitting in rooms with it. He is great, and I like the confidence that Dr. Zink expressed about it. But the reality is hospitals have a lot of staff out sick with COVID. I forget what the number is exactly, but they've talked about it in the last couple of days. It's not a trivial number. So the biggest problem I had was seemingly going forward when things were on fire around us. It just made it much more likely that it was going to be in our buildings, and buildings would become a transfer point, which then adds to the stress on the community, which is what we all don't want. So while 30 may not have been the right number, and maybe that particular calculation isn't exactly right, it seems like there does have to be some kind of a number and some kind of recognition about what's going on in the community. When things are too dry, or when there are big fires up in Matsu, I'm not allowed to have a fire in my front yard in a fire pit, because we just say, one, we can't tax the resources that are already in use fighting fires elsewhere, or two, the conditions around me. I may be able to control my fire, but if 50 people have a little fire that evening, 1 or 2 of them are going to get out of control and become a huge problem. I think that's the situation we're dealing with. It's not necessarily our fault, or that we weren't ready, or that we didn't have a good plan. To be sure, people had concerns about it, but in the setting we were in, I think that's where a whole lot of apprehension came from. So I do hope that before we would talk about going back, that we do have a set of conditions that have different weights attached to them, that we can all look at, and we can all look at what's going on in the community. We can look at what's going on inside of our buildings and sort of have some sense of which direction we're going. In this case, I think a lot of people felt like it was more of a black box thing. They couldn't tell what might happen that would influence it one way or the other. And that simply leads to a lot of speculation by people, and leads to a lot of bad discussion that's toxic for the staff, toxic for the community, and toxic for kids. So if we've got some parameters that people can look at and understand and agree on, then I think we'll have a much smoother phase in. And that would also include the timing and the progression. If we do start back with pre-K to 2, what does that mean about 3 through 6 coming back in? And are we going to have a gradual ramp up in middle school and high school, or are we just looking at all students showing back up on a given day? So I think all those are questions that people have started to realize and think about as we've gone through this process. Thank you.
Thank you. And those are great questions and have been answered over and over again. And I want to share, to the strength of the decision making, what was noted in that occurred really very quickly over the last week is what we responded to in the hospitalizations. So I'm hoping that the board feels that that's evidence that you have really high quality professionals working in each capacity. You have these people here that are the top of the line in their expertise. This is their second job generally. They've led the country in these things, especially Tom Roth. Jennifer Petronas. They've led the United States in some of these actions more so than just this is a smaller unit to them. So I have confidence. As you know, when the condition did change and we were notified because we all are tied into our medical community, we had to adjust. But I do want to share that the pushback on me has happened in July, in October, in September, November, in many, many times. It has occurred to not go back. And so and I think it's just the discomfort of the unknown. It's always going to be something new that we don't know because COVID's so new. But I want to gather our resources and utilize the information that's out there to be able to allow our school district, just like others around our state and the country, to take those baby steps back into service and servicing kids. And the matrix, we have shared that it's information, their data points, along with our mission about what we are supposed to do each day in meeting kids' needs. I share again that my communication with the city has been very similar. When there is a new emergency ordinance, when perhaps they have to make a trigger point for a hunker down, when I asked, because I wanted to, if I could have modeled our work on the cities, what's your trigger point? There isn't a single trigger point. Just as Member Holloman said, it's the medical part and the beds, and can we do that? It's what's the economics? What are people going to do? What's the behavior already? What do we need to take care of? What is essential that we keep open? So the city itself, as well as any other organization or sector, the hospital sector, we're all making decisions at decision points of information that we have. And collectively, and that's why we're very transparent, as you can see at the health meeting, last Wednesday, when asked, the health department knew where we were. They knew our plans. There's been a lot of requests from community councils. I know that folks in community councils have also shared information with the board about the city reviewing the plans. I'm confident they have reviewed the plans. The Anchorage Health Department sits with us. Their doctors are part of our team, Dr. Chandler, and has been from the beginning from last year when a plane was landing in Anchorage from China. I just want to share that I don't know other than saying the information, is online. I think the request is like to have it be black and white just so everyone understands. And I'm afraid that COVID is so new and the nuances of the decisions are really complex that when one decision's made, it moves another trigger and another lever. And so however it is that we can continue to communicate, maybe meetings like this, letters, sending out information to staff. But sometimes the letters are too long. And I've had a response, these letters are too long, I never read them. You didn't provide enough information, I don't read it. People didn't know the information, or they heard something else that might have been online or on social media. I am open to how we want to educate people and our own people about it. If it was a very particular, I'm sure we could all do best, but as times change, the information changes. Certainly, what we knew in March is different than what we know today, and we're doing our best to stay on top of it. But I'm hoping that the confidence that the board has in the team here, that you understand that those high considerations are about, can we be successful in the classroom and understand and supporting our community? And up until we received this weekend their staffing problem, we continued to move along and be confident that we had that pullback just now. But that wasn't what was happening in July or September, or October, when we had to pull back. That was really just, probably the unknown and the fear. But we have to, to move forward. And We want to work with people to move forward. So any suggestions on doing that, we would welcome it, build capacity around it to move our district forward.
Next up in the queue is Board Member Mitchell.
Thank you for being patient with my unmuting. Thank you. So I am just wondering about, Dr. Bishop said we do have a rubric that she's talked about, or we do have an approach and that she's talked about. If we could just go through that again. And I'm curious with the, and I also want to thank teachers for all the hard work teaching that they are doing with the online. They're amazing things are happening. So I just want to thank them for that. In terms of the rubric, the chart that Mr. Donnelly talked about, which I do appreciate because it does dimensionalize things much more. I guess I am wondering how you're weighting these different factors. In the secondary indicators, in terms of the hospital beds, we're in the green area now, but obviously those are understated because that does not refer to staff beds. But in your, I think that what we really need to focus on is, or what I would like us to focus on is having, when our teachers and when our parents made a decision back in August as to whether or not they were going to come back, they used this risk level matrix. And then that fed into this, what our schooling was going to look like based on where we were. And I do respect the fact that we know more now, and we want to incorporate that new knowledge into our new decision making, which is absolutely appropriate for a constantly learning and data-based organization. But it was very clear to them, and they felt very comfortable that, if we're medium high risk, here's what my school is going to look like. And I know going in making this decision, that's what I'm going to do. So I'd like to maybe go back to the rubric we have and just talk about how important are these different factors, and what other things that aren't on here that we could maybe quantify, could we do that with? Because I think having clarity would really help everybody. I think it would help the parents feel more comfortable. I think it would telegraph to people a little bit more, because I think what people were looking at over these past, I think it's been about 5 weeks, Dr. Bishop, since you had made the announcement 4 or 5 weeks ago that we were going to go back on November 16th. And I can't hold it up because it's on my screen, but in the rubric that we're using now, the number of new cases per 100,000 within the past 14 days, which is our new top core indicator, people saw that number going above 200, going above 300, going above 400, and now it's above 1,000. And I think they kept looking at that and just wondering, wow, this is going up and up and up. And this is, one of it's the number one core indicator. And they were confused and they were concerned. And so I think if we can somehow put some parameters around what this is going to look like, it would be extremely helpful to everybody.
Thank you for that. And as Member Donnelly shared, it really for a lack of any kind of metric, we adopted what was used in senior housing centers. And so that's where that comes from. And those are areas that they really have control over entry and non-entry, and admittance and non-admittance. So school districts around Alaska began to utilize that because the first one was out. And then later, so we built our matrix around that because that's what we had. In September, as we shared, the CDC came out with school guidelines because it became apparent with support from the American Association or American Academy of Pediatrics that having students out of school has actually some other factors that have to do with the health of a community, not just COVID. And so they challenge schools to incorporate more information, not only about their community, but that the implications of what happens when schools and services to children are out longer. So in addition to that matrix changing, which Jen can share again and give you a review. Our operations of our courses changed. Of course, we started from scratch a virtual program. All of these programs aren't necessarily, this is what I thought I was getting, because nobody really knew what it was. We created it. Everybody did, teachers, everybody. And so to believe that this is what I thought I got, these are being created every day, and teachers are being innovative and really pushing it forward. But what we've done then is not, if you notice on that medium risk and high risk, it's no school for all or some school. And what we've done is really understand over time the impact on children and the society and the health. And Mark can talk about that. But again, our plan isn't to roll everyone in, and I think Member Holloman asked this, all at once. We have school districts that have everybody back. What we are asking for is this phased in of the youngest children first, who really have they don't have the self-efficacy necessarily to sit in front of a computer screen and have that answer response. They are engaged with their teachers when they're on there, but we know that the longer kids are on screens, it's not necessarily good for them. They need a lot of supports from home, and those that don't have the supports, which isn't just a socioeconomic issue, it's really, we're finding it in all schools, because really they need a parent assistance or some older brother or sister assistance. So, Mark, can you really share that information about how we've really evolved from a simplistic approach of, up and on of a light switch to really the human element of the full category of decision making?
Thank you, Dr. Bishop. I want to start by just simply saying this is me speaking, and I'm not speaking, through a district lens on this, but I think the essence of your question, Ms. Mitchell, I think is really around what people are asking for is predictability and stability. And I just want to tell you, there is nothing about this virus or anything that's happened since March of last year that is predictable or stable. And so what people are wanting out of their lives is something that they can find stability in and predictability around. And we have been in a constant state of planning since March, over and over and over. And that continues because that's our job, is to plan. And so, my team, they have spent so many hundreds and thousands of hours just planning around all the different scenarios. And we'll continue to do that because that's what we do. So I feel like, to answer Dr. Bishop's question about how do we go through this, when we started this, the only metric that we really had was very simple, and people like that because of its simplicity, 30 cases or more, et cetera, et cetera. But that does not describe the complexity of this issue. And so as time has gone on and as this is dragged on, there are more and more weightier factors. So what was kind of what we thought was a short-term scenario has now become a longer and longer and longer term. And therefore it's become less predictable. This very metric started very simple because it was simply a medical, and then enters other things, the community's ability to handle it, all of those things. And now what's entering into the picture is another set of metrics, which we can't put numbers to, which are metrics around social health, emotional health, mental health, the growing achievement gap that Member Bellamy has addressed many times. These are things that are now weighing more and more that come into the picture. And so as time goes on, other factors start weighing in, and you can't put a number on it. I mean, our own community can't quite put a number on what does it have to be for a restaurant to close or a bar to close, or what number do you need for any of those. And so it's a very tricky question you've asked. I don't think there is such a thing as a simple metric. No matter how hard we try, boards and community leaders can't take the judgment out of this and turn it into a simple metric that a number can be that predictable. We have to apply our judgment from experience and our weights to all those metrics. And that's why these things provide guidance for us. They do not answer the question. There's no way you can shoot this out as an algorithm at the end of this and tells you exactly what to do. And I know that was a roundabout answer, but that's because this is a difficult and complex question. There is no metric that we can crank out that will make a decision for us.
Thank you. Next up in the queue is Board Member Marset.
I want to say thank you to all the comments from the board members. I do think this has been a very worthwhile exercise and discussion. I would like to propose at our next board meeting that we place on our action item to halt schools until January and extend our school year. I'd like that to be on our action items. And this is enough notice, and we can put it out there publicly that this is something we would be discussing. So I believe that's very important, especially in the timeline of when we have to do this. And I don't know how soon we have to vote on this to change the calendar, if that's what we choose to do. The other thing I'd like to propose or have a discussion on is the return of all students by February 1st. I know that we're looking at putting our second graders back in, but I hear over and over the need, not just for our younger students, but all of our students. And if we put that out there and we give enough notice, that can be a discussion that we can have. I also want to say that first, I want to thank Mayor Quinn Davidson for putting in the extra mandates. I also know that JBEAR has pushed out some pretty strict mandates for their military. These are individuals that are taking this very seriously so that we can mitigate the numbers in our community. So I guess I asked, where's the state in all this? Because I've not seen anything from our state leaders. And then where as a community do we take responsible for getting these numbers in check? And I'll just share with you, I went to Fred Meyer's last night and I saw two individuals walking around without masks. And so I approached the manager and I said, so can you not ask them to put their mask on? And he said, no, we can't do that. And I said, well, can you ask them to leave? And he said, no, we can't ask them to leave. We can't make them leave. I said, so you have a mandate in front of the door that says that the mayor's mandate is you will wear a mask in this store. And at that time, the security person came over because I was very calm. But I said, so is it more important for you to make sure that I don't cause a scene than to protect the health of your store workers and people that come into the store? So that's just one example where we're not holding our businesses accountable for enforcing the mayor's mandates. And until we do that, we're going to continue to see the rise in these cases. So as a community, we really have to reach out to our local community, to our state government, and ask, what do we need to do so that we can get our kids back in school? And until we're ready to do that, we're going to have these conversations over and over and over. And I've said this many times about many things, but silence is acceptance. And as a board member here and now, I will no longer be silent.
Thank you. I heard a couple of things. One of them was a request to put a calendar action item on next week's Monday the 16th. We're meeting on Monday instead of Tuesday. Is there interest from another board member to have that discussion as an action item? I see board member Hildy's hand up, and I know I'm open to having that conversation as well. So we'll go ahead and put a placeholder on it tonight and make sure it gets announced out to everybody as early as possible. I can see two possible options coming out of that. The other thing you brought up was a February return of all students. I think that's probably one we're going to have to chunk at through our meetings that we'll still continue to have through obviously November, December, and January, and seeing where things go before that actually hits as an action item on an agenda. But it was heard. Just want to be clear on that. I had my hand up in the queue, and just one quick question on the potential return for school on the 16th. There were 3 days set aside, Wednesday, Thursday, and Friday of this week. I understand that Wednesdays have always, kind of been the asynchronous day, and appreciate Dr. Stott going back and having those conversations. However, Thursday and Friday, what is the plan for teachers and direct instruction to utilize that time the very best?
Thank you, Madam President. I'm going to turn this over to Dr. Stock because we did have some requests for school visits still, as well as other information. I believe his team and the Senior Director of Elementary worked through that today. Dr. Stock?
Thank you, Dr. Bishop. And I'm going to ask Senior Director Daniel Barker to join me because this definitely affects his lane and he has some more details on with regards to that. So Dan, if you would.
Yes, absolutely. Thank you. Good evening, school board. And through the president to the question, I guess the president posed the question. So through the president to the president. The adjustment that will be made Wednesday, November 11th, which is this coming Wednesday, was always an in-service day. So the status of that day won't change. It would have been asynchronous even under a non-COVID calendar schedule. It was a training day assigned for teachers at building discretion. So that will remain. This Wednesday will be asynchronous building in-service taking place on site with building principals and their staffs. Thursday and Friday, which previously we had assigned as work days for teachers to prepare, will return back to the synchronous or instructional day as we've known it for all this semester. So Wednesday will remain an in-service non-student day. Thursday and Friday will be synchronous online Zoom / some asynchronous content, but normal instruction as we know it this semester.
Thank you. That did answer my question. Board Member Hildy?
Thank you. I just want to thank Member Marcet for reshaping the discussion as to solution-based, right? What can we do? We all have the same desire. Teachers, parents, administrators, school board members, everybody wants children to be learning as best and as safely as possible. So how can we get that? And I hope that that is the conversation we start to have. So putting it on an agenda for next week, that invites the conversation. So we can direct how we talk about this. We can say we need to get children learning in, young people learning in a direct instruction with their teachers in a safe way, but we also need to address right K through 12, pre-K through 12. What is that going to look like? What's possible? And bringing that in from our community. We've started to get some emails from that, so I really appreciate community members who are starting and teachers who are saying, here's what might work. Here's some things that I think could work. And when we do that, right, like Dr. Zinka said, it's not us against each other, it's us against COVID, right? So when we start to talk about that, I don't know the answer about closing schools now and reopening for K2 in January. I don't, right? That's just a new idea. But if we have the opportunity to discuss it and we have opportunity to put it out to the public and say, and Dr. Bishop and her team have time to think about it. And, single moms can say, is that helpful to me? Or is that more stressful if I don't have to try to work and teach my kid at the same time? That's really hard, by the way, just so you know. I got K2. It's really, really hard, near impossible. So I appreciate that discussion. The return of students by February 1st, I don't even have a kind of picture of what that could look like, but I really want to talk about what could it possibly look like? What is the potential? So thank you. And then I hope board members will, start guiding discussions when you're in community councils. What are the solutions we can find to this? So that's all I want to say.
Thank you. Next up in the queue, and the last hand that I see raised, unless others pop it up real quick before we move on to public testimony, is Board Member Bellamy.
Thank you. I just had a comment and a question. So I think that while we may come at this discussion from different perspectives, I think the common thing for all of us is our kids and delivering quality education in this community. So, and this community supports education. Yes, they do. We cannot separate ourselves from this community. This community is how we are able to deliver education. And so, while I absolutely appreciate that our job is to educate and to figure out how to educate, we also have to figure out how to make that happen within a community. And right now, this community, the levels in this community are extremely high. We've already dealt with that, but I did want to just, for me, community is more than just sitting on this school board and making decisions. The decisions I make come from the community in terms of what their values and their visions are. We agree, but sometimes I think we need to be reminded of that. And my question is for Jennifer Petronas, relative to, and I get the difference between COVID notification and COVID, what do you call it? What's the other term? We don't do tracing. We do notification. So how will that happen when we are back? I think I got it, but how will we do our contact? How does the contact tracing inform my notifications? And then how will we track that within our district?
Through the board president to Member Bellamy, we do contact notification. So let me give you the definition of contact tracing first, because that's probably helpful. So contact tracing involves someone calling an individual that tests positive, which would be considered an index case, and asking them about their health history, their family's health history, where they have been to CARS, Costco, how long they were there, have they been seeing any family members in the hospital, has anybody that lives in their household have symptoms, and anything outside of their home, what they've done, and tracking that. We're not doing that. What we're doing is once we get notified from either the health department or the individual that they tested positive or that they've been identified as a close contact, we are taking that information and gathering the data. When did they test positive? Did they have symptoms? And then calculating the dates that they're released from isolation or quarantine and providing a letter to them that clearly states what day they can return back to ASD. Okay. If they have close contacts within the Anchorage School District, we're also providing a letter to those individuals that have the date they can return back to ASD. It also tells them where to go for questions and when to get tested. We are tracking that because our awesome IT department made a system just for us where we can track that information internally and log it and look at it every day.
Oh, okay. Will that be available to the public or just internal?
That information is just internal.
Internal. Okay. Thank you.
And Madam President, it is again to protect the rights of the employees and students because of it's by name and that's health information.
Yeah, but you can give numbers by location.
Yes, that is public, but the information is not.
Yeah, I totally understand FERPA and HIPAA. Thank you.
Yeah. So we do make and have made the numbers public. We'll continue to do that.
Next up in the queue is Board Member Mitchell.
Yeah, I very much appreciated Dr. Stock's discussion, and I do understand it's complicated and there are many factors that go into this. I think it would be helpful for parents and teachers if they could have some type of a sense of what, you said there are many, many factors that are weighted. If you could put together a list of those factors. So in addition to the matrix that we're looking at, what other factors do you look at? I know suicide is one of them. That's been mentioned a few times. And then, you probably can't put an exact weight next to each of them, but kind of an order of magnitude so people can get a sense.
I'd like to add to that as well through the president to Member Mitchell. In my review of discussion with parents about in other school districts that have gone to school, as well as talking to the colleagues in the Council of Great City Schools, one of the biggest asks from parents has actually been the connection with their principals. So they want to know at the school level, not necessarily this matrix of go, no go. What they have shared is from the principal, what happens if a case is here? And the guidance again is, on the website globally for everyone to know. But the people that are trusted, and this is longstanding research and education, are actually my school and my principal. A lot of times when public education gets, a bad rap, it's over 80% of people, I think about 88% of people say, I support my school, my teacher, my principal, but public education is not good. And so it's this idea that public education is outside that personal relationship. So what we do know is that the communication from principals is key. And so our principals have set up just so that these town halls, if you will, so that they can answer those questions, as you said, from parents. What would happen if my child, if somebody in the class had a symptom? What would happen would I be notified about this? What happens when a case happens in a classroom? What if a staff member can't be there because they became a close contact? Who's going to take over the classroom? And so we've really concentrated, and I think that this might help our community to really work around the support of our principals in being able to answer those questions. It is very important for our principals to be able to really discuss with their staff to create that environment, if you will. We can and will put up the kinds of discussions we have in regard to what do we look at. Can we go back and effectively run a positive school day for kids, and what that looks like in conjunction with our partners in the city. As Member Bellamy shared, we are a large part of the city. And so we'll write a statement about that, but we'll also continue. We had some suggestions about just continuing those town halls by principals or those school visits by principals, because truly the principal is a key feature in the leadership of that school and the success of the school outside of COVID. And so I just wanted to make those suggestions as well as some of the things we're working on for the parents in regard to having the parents feel confident in that.
President Vacalis, can I just follow up for?
Yes, ma'am.
Thank you. Thank you for that, Dr. Bishop. And yeah, I've actually sat in on a couple of those town hall meetings, and the principals are doing a fantastic job. So again, to get back to what I was asking about, clearly you have many factors that you are looking at in terms of whether to open and close. And I also understand that how you balance those different factors is going to be different for different age groups. So, if you could maybe highlight that a little bit, that would be great. Thank you. I'm not getting COVID, just a dry throat.
All right. And she said she'll get that addressed. Next up in the queue is Board Member Holloman.
Thank you. I'm going to touch back again on a matrix, and I do clearly understand that we can't have something wonderfully mathematical to where anybody could plug the numbers in, turn the crank, and go, okay, it's a go or it's a no-go. I think we all understand it is more complicated than that. But if we can have an outline of significant factors, what that does is let people know what's being considered. And that creates the atmosphere of safety and understanding that I think will bring the community along, will bring staff along, to the point that we will be able to do what we need to be doing, which is educating kids, ideally in the buildings. But I think also it's time that we recognize that even if we can come back in January, or we put it off until February, or whenever we start, we're going to have classrooms that start and stop. We're going to have staff that start and stop. We're going to have kids that start and stop. We're going to have buildings that start and stop. That's what we're seeing on the Kenai. It's what we're seeing in Matsu. It's what we're seeing all over the country, because so many odd combinations of things happen with this disease that remain unpredictable. And as Dr. Stock pointed out, as it evolves, it continues to confound us in these different ways. But when people know the factors, even if they don't necessarily know the precise formula that they weigh in, and there may not be able to be one, they begin to have confidence that these things are being thought about. When they're not sure, that's where the fear begins to get driven. Because ultimately, at some point, you're a teacher in a room with a bunch of kids, and you may have an issue that you need help with. The district doesn't always have somebody that can help you. I only have 20 years in it, but I'll say that happens sometimes. There's nobody to call. Security is not always available. And it's just every so often in normal times, everybody in the building is busy. It just happens. And I think there's a big concern by staff that could happen to them in their classroom, except they're dealing with an infectious disease that's harmful to everybody. So I hope people don't feel like people are unnecessarily afraid. To be sure, some people have panicked and gotten afraid. There will always be individuals that say bad things or do bad things or have bad moments. But beginning to attribute that to staff in a general way, I think is really damaging. I know so many people that very much want this to work, but they feel or fear that key parts of it aren't being considered yet, or that they're not going to have the key components of things they need. And getting to that point is going to be tough. The idea that we might pick a date and say, this is when we start back, no matter what. Personally, that instills fear in me when it's going to be a go, no matter what the conditions are, when this has been so unpredictable. I think everybody wants to know that if certain things get out of bounds, that we'll be able to pull the plug and stop. I don't think anybody thought we would have 500 cases a day in Alaska. We all knew it was a possibility. I wouldn't have bet money on it, but Ann Zink predicted that that's probably what would happen. And we don't know how many days we're going to sustain numbers like that. If it's 3 or 4 or 10 and things start going back down, we're in one world that we can kind of manage. If it's 20 or 30 or 40, we're probably looking at full hospitals, which means we don't have an outlet for people that get sick, and we're not sure we can handle that. So I appreciate the idea that we should be forward-looking and say, how do we do this? I do think what you've done so far with bringing in individual kids or kids in very small groups that need individual attention is awesome. We should expand it. We should be expanding the private groups that we're letting use our space while it's not being used for classes in order to relieve stress in the community. That needs to be expanded. If we have creative ways from people in our buildings to reach out to people in the community to start to deal with some of these individual issues that are very crushing for parents and for kids that aren't getting served, we should be expanding that, because we know we can do those things in small numbers safely because it's always so much more control. So we absolutely, I hope, are moving ahead on all those as we can. And at the same time, looking for that day when we can bring more and more and more people back in without the concern of them getting sick. But I will always be cautious if we potentially are going to do things that will make Anchorage sicker than it is right now, until we get the numbers back down to where we know the city has some control, and then we can function within an environment of control. I think that our staff members from top to bottom, from our cafeteria workers, our BPOs, up through the academic staff, up through the support staff, into Boniface, I think everybody is working on that. Everybody wants that to happen. Everybody has some bad days sometimes, but I think it's sad to characterize that as the norm. Thank you.
Thank you. I appreciate that and look to really working with the city. I do want to give a shout out to the Assembly again for really supporting those joint efforts that you had mentioned, Member Holloman, in regard to the mental health with the Volunteers of America and the United Way work. So again, it is over $1 million that they put from their CARES money into partnerships for people to partner with ASD to do those outreach. In regard to, I just want to have an understanding of the ask, a paragraph or whatever on our website, because certainly if this is the key to people understanding, we talk about the new criteria with the CDC guidelines, and there's definitions to that on our website. And then it really has the additional considerations of the impact on social emotional needs, behavioral mental health, and absence or reduction of critical services such as school lunch programs, special education services, after-school programs, and mental health services. So would it be helpful if these were defined? Is that what the ask is? Because they reside right with our matrix in understanding these are the CDC medical matrix, and then these are the other considerations. And I'm wondering if that is something that needs to just be expanded about, maybe defining each of those, that and understanding that the impact on students and their health. Is that what was the ask, Member Mitchell? Or Member Holloman? Just to expand on those indicators?
Where are those other indicators listed? I'm sorry.
If you go to the updates, just where that's about the COVID information and the chart, when it talks about community matters, the new criteria for guidelines, additional considerations, and the decision-making criteria charts right there, they reside right above the chart.
Yep. I think that needs to be, there needs to be some metrics around that. Somehow that needs to be quantified a little bit more.
Yeah.
If I can jump in and add that.
I think maybe defining them, I don't know how I would quantify a social and emotional need. They're there in our community. Would they be?
Well, maybe explaining what metric you look at, how do you assess that, and whether it's increasing or decreasing.
Board Member Hildy?
Member Mitchell, through the chair, I don't know. Are you thinking like a list of some of the factors that we know exist in child development, like some of past research, some of the data that we've had for years on the needs of children and learning and their growth, having those factors listed and, research that supports those? I guess I'm struggling to understand what you're looking for.
Well, I think people understand that having school open or closed impacts social emotional needs. I think that how does the administration assess whether these things are reaching a crisis level? What are the data that they're using for that?
Yeah. That's a good question. That is a good question. And hoping that we had really shared some of those data in our metrics and our monitoring in regard to the number of interventions that are lacking at this time last year compared to our trend of data in regard to self-harm in our interactions in doing interventions. Dr. Johnson shared some of those data. We had over 200 the first quarter in previous years, less than 25. So from the trend data, we do understand that there are needs that are not being met just because we're simply not in the classroom. The Child Protective Services have shared with us, as well as that 80% of the referrals come from schools, and those are significantly down, so we can give you those data. But certainly, the flexibility to adjust to the needs is really a part of this, that as we learn more about our students being out longer, that impact is just certainly just changing all the time. And we can certainly share just what we look at around those in understanding the need in our community, whether that be one of the pieces of information that we already know that I heard actually a board member share is we already know in any other given year, the abuse to women in Alaska is the highest. Abuse to children, sexual assault. We have some of the highest numbers in the nation already. And understanding that, and then the impact of not being in school, and understanding how reports are made about impacts to children. So a lot of these are just utilizing what we know and then being away, looking at our data about what we've done so far and been able to impact. That certainly weighed on us. And then I have shared while the data the counter to that was, well, it's not any more than any other year, but certainly in ASD alone, 3 suicides in 6 weeks really impacted us as educators and teachers and leaders to understand that. Kenai just experienced their second one last week. A young high school person wrote about it in the paper. So, that's what I mean about very difficult to then put a sign or a label on those that the letters that we get, as much as we're wanting to support and wrap around about the fears about COVID, we want to wrap around the support about what's happening in our families and supporting those. It's just very difficult to talk about, very difficult to explain without really the shame and sometimes that goes with that and our families. So we'll try to define some of these and share more data with you in regard to our trend data and then what's happening this year to provide a picture of those wraparound services that we might not be meeting.
Thank you. And yeah, that is interesting with Kenai with them being in school and still having that. So yeah, thank you.
Actually, Kenai's out of school. All the peninsula, it's the smaller schools that are in. So this was a child writing to come back into school. The peninsula is out. Soldotna, Kenai, Soldotna area.
Next up in the queue is Board Member Holloman.
And it goes back to a question that the superintendent asked a little bit ago. We may have to change how we talk about these in the same way that these different factors can't be quantified precisely. The communication may have to be verbose and imprecise, again, as a way to transmit that these things are being thought about, that these things are in balance. I understand we can't do a precise calculation on the number of cases in the community on a given basis, on a given day and say, okay, things are good or things are bad. But the question a lot of people kept asking is, does this matter anymore? Is this going to make a difference? And I think it can be discussed in the context of in relation to other things and how it's working. That's what's happening without having to be pinned down to say, okay, if it crosses this boundary, then we're good. And if it's above this boundary, it's bad. I continue to understand how that's not doable. But in the absence of those precise parameters, no one has any idea what the parameters are. And that drives fear. And I think if we want to get rid of that, it may be that you're going to have to blog a little bit or do something that communicates with the whole community as well as your staff, as well as specific segments that keep them informed about what your thinking is and what you're hearing and what's beginning to be the most pressing issue. And with that, I think lots of people will start to come along and understand where we're going and why. They'll have a better idea of what they need to do to be ready to be part of that. Thank you.
All right, I want to thank all the board members. I don't see any other hands up in the queue, and I know that we do have 47 people signed up for public testimony. I am going to ask if there's any opposition from board members to the original plan was to do an hour of public testimony and then deal with our action item and then come back to the rest of the public testimony at that time. I don't believe there are any action items right now that are going to happen. So my request to the board is for a 5-minute break and then to go through all 47 public speakers at one time. And I'm looking for board concurrence on making that agenda switch.
So if we have an action item on the agenda, don't we have to at least vote on that action item? Or, well, we didn't amend the agenda.
So member Kalis is asking to amend the agenda by consensus since even though an action item is listed, nobody's made a motion. So until there's a motion, there's nothing we have to do other than we can amend the agenda by consensus. Okay.
So is there any opposition to 5 minutes and all of our public testimony all at one time? All right, not seeing any. I'd like to return back here at 7:06 and get through all 47 people and hear their voices. Be right back. All right, it is 7:06, and as promised, I want to get going. So, quick statement for public testimony. The board welcomes public comment. We value public comment as it ensures that we remain aware of public thoughts, ideas, and concerns, and informs our decision-making process. The school board encourages anyone wishing to provide public testimony to sign up in advance for in-person or telephonic testimony, or to email written comments by 2 p.m. the day of the meeting. These comments will become a part of the meeting record. If you have signed up in advance for in-person or telephonic testimony, you will be called on in the order in which you were signed up. You will have 2 minutes to testify. When 30 seconds remain, a chime will ring to inform you so that you can finish your sentence. Additionally, it is not our practice that board members answer questions or engage in discussion with members of the public. This is your time to speak and our time to listen. The board will consider all information shared by the public, and when deemed necessary, issues raised in testimony will be referred to the administration for follow-up. First up on the list, go over to, is speaker number 1, Barb Clark. Barb, are you with us tonight?
Hello?
We can hear you. You have 2 minutes and the floor is yours.
Thank you so much. Good evening. I'm deeply relieved for my early elementary colleagues, and I applaud the decision to keep them and their students safe. I continue to believe that there must be a plan that has clear public conservative guidelines, including some specified rate of new COVID infections, some kind of metrics for medical facility and personnel capacities, but also metrics for assessing school personnel capacity. How many healthy, non-high-risk teachers, nurses, support staff, and subs we have and will continue to have as the pandemic moves. The virus is still highly contagious and still potentially deadly. It can still be carried by asymptomatic people, staff, as well as students. There's still no vaccine, though since last I spoke with you, one has come closer. It's still transmitted almost entirely via people within 6 feet of each other, not 3 feet, not 6 feet where practicable, 6 feet. Deep cleaning might mitigate its threat a bit, but not much. We don't get it from the floors or the furniture. We get it from each other. The death rate for the virus seems to be dropping a bit as treatments improve, but the catalog of potential lingering after effects, even in children who exhibit no obvious symptoms, is growing and to an unknown extent still not exhaustive. Cases are skyrocketing, life is moving indoors for the winter, and our community is still gripped by fear and uncertainty. We can alleviate the fear by letting people know that they'll be kept safe, that they need only to adhere to masking and distancing guidelines, and the virus will retreat. But the uncertainty, that will take clear metrics, a transparent template that we can see and trust. There's only one huge certainty that we can't have because it isn't knowable. A date, weeks, maybe months in the future at which the virus will be in retreat. That might be February, it might not, but we should all be able to know how we'll know it when we see it. Thank you.
Thank you. Next up in person is Miranda Strong. Miss Miranda, we have a timer that you should be able to see on the bottom here. You have 2 minutes and the floor is yours.
Good evening. I am Miranda Strong, and I'm asking you to put kids first and open schools as someone who is unschooled. I spent my 4th grade through 6th grade years on the Kenai Peninsula outside of the school district until the 7th grade. Can you not hear me okay? Thank you. And I grew up in an area that apparently is still struggling with a suicide that unfortunately was part of that landscape at that time. I also had people in my peer group who struggled with substance misuse disorder, even to the point of overdosing. I'm confident that my life would have been very different had I not been able to re-enroll in private school, and have the benefit of caring professionals at that time. I still benefit from the mentorship of one of my teachers from that period of my life. My brothers had IEPs. They languished at home. When they were re-enrolled, they thrived. Now they're living and working independently. I'm also asking you to put kids first and reopen schools as a single working mom. I love Rogers Park. Zoom L is very hard on my family with childcare, co-parenting, as well as 2 very active 1st and 3rd grade little boys. And I'm finally asking you to put kids first and reopen schools as a former child protection attorney. I understand that the 80% referrals to OCS from schools that Dr. Bishop cited as a current statistic, and that resonates with my prior practice. The families who most need schools to open are probably unable to come and testify to you today. They're probably not filling out surveys, and the kids in those families are not logging into Zoom. They're not homeschooling, and they're not okay. So please don't try to manage down to zero risk. Please put our kids first and open schools. Thank you.
Thank you. Oh yes, we're not supposed to clap because it could, I don't have that wording with me.
Please refrain from clapping so that all voices can have an equal opportunity to be heard.
Thank you. We'll get that written down for me. Next up, speaker number 3 is Annie Massey. Had a family emergency, so Mandy Mercurio is going to read for her statement specifically. Mandy, are you with us tonight?
Yes, can you hear me?
We sure can. You've got 2 minutes and the floor is yours.
Thank you. My name is Annie Massey. I have 3 children enrolled in ASD. I support all grades returning to in-person education now. Despite one board member declaring an emergency and asking to close schools to thousands of students, a greater community of parents, and I'm learning educators, which you will not hear from for fear of union intimidation and retaliation, are asking for schools to open, despite the high rates of infection and the very same data that we are all looking at. This is evidenced by the community of parents who chose to enroll in the at-school model. This community researched and recognizes the same data and are ready to start working on living with this virus just as the private sector has been required to do. This community realizes this crisis is controversial due to the vastly differing perspectives between community members, but is absolutely not in anyone's control. Parents have a right to the education delivery their child needs. Although some teachers have testified their students are doing just fine, let me remind you, it's only a parent who can attest to their child's well-being. Parents are people who possess the ability to affirm or deny their child's reality. Some parents will affirm their child is great, and I'm happy they get the opportunity to continue in their online learning environment. But for a vast majority of families and teachers as well, we agree this present reality of instability and social isolation has damaged our youth's sense of hope into relentless hopelessness. And we parents have a front row seat to our children's dwindling well-being and academic performance. I urge this board to reach out to each family to get a parent's perspective about what they need for their child. Thank you for this opportunity.
Thank you. Next up, speaker number 4, Alina Durso. Alina, are you with us tonight?
Can you hear me?
We sure can. Thank you. You've got 2 minutes and the floor is yours.
I am a military spouse, a mother to 2 ASD students, and I have been an educator since 2000. I have taught in 6 states and 2 countries, and that has allowed me to see how many districts and communities work and live together. I've taught through tragedies. In 2001, my 3rd graders watched a plane strike the Twin Towers right from our classroom window. A few years ago, while working at a school in the Netherlands, my school lost classmates, colleagues, and friends to the airport bombing in Brussels. I've held crying children who've lost a parent. I've been with students when they've received devastating news. Those were all tragedies that could not have been stopped. We are in the midst of a tragedy now, and I thank you for postponing face-to-face currently. I've heard many share the issues that they have with the current reopening plan, and I feel that the one major thing that is easily forgotten when they speak, every one of them, myself included, wants to get back into the classroom. Every one of us does, but we also need to share the holes and inequities in the plan. When a cancer patient gets diagnosed, they do a dentist for their treatment plan. Well, yes, still in the medical field, the dentist doesn't deal with that situation daily. You always go to the experts in the field, and that, in this case, is us. We are the ones who are in the classroom day in and day out with these age groups. We know what this plan will really look like or not look like. This is what we do. We create classrooms every year and every day, and when we say there isn't enough room to distance, it's not to be difficult. It is simply a fact. When we say that every classroom protocol will not be equitable, it is not to be difficult. It is simply a fact. I understand wanting to bring kids back in school, but after our record number of cases in Anchorage, teachers may not feel comfortable getting within 3 feet of their students. So may I ask how this is going to help? We can't forget that while kids have lesser symptoms of COVID, they are not the only ones in the school. COVID knows no age. It doesn't care if it travels from a 7-year-old to a 50-year-old. and now both become vectors in our already overburdened system. Schools are supposed to model the right thing to do, and I wonder if by continuing to push ahead with this plan, if we've become complicit in allowing the community to think we don't need to worry. I urge you to wait until it is safer. Thank you.
Thank you. Next up is speaker number 5, Kristen Bush. Kristen, are you with us tonight? Kristen, if you can hear us, it should be *6 to unmute.
Can you hear me now?
Yes, we sure can. Thank you. You have 2 minutes and the floor is yours.
I fully support the plan for students to return to in-person learning as soon as possible. Your core value and belief statement that you are open, transparent, and accountable to the public, because it appears the district has been more interested in being accountable to the teachers union and to a power-hungry replacement mayor than you are to the public. Mandates are not laws. Please fight the muni on behalf of our kids. Look, I'm not deaf to the challenges this year has presented, but I would caution you that you have collectively developed tunnel vision as it relates to COVID-19. This virus will not disappear. It isn't going anywhere. Even if a vaccine becomes available, there will still be people who contract this illness, but most of them aren't even sick. How long do we continue this exhausting rhetoric that we have to slow the spread, protect the vulnerable, flatten the curve, safeguard our hospitals? How long? You seem willing to close school for the rest of the year, next year too. You act like there's an end in sight, but there isn't. It is tragic that people become sick, hospitalized, and even die. But we are not immortal. The human race has a 100% mortality rate. Speaking of deaths, our kids are the silent death knoll because you have not opened their schools, and just mitigate the best you can. Suicides are being attempted, and some resulted in death. The Muni's Dr. Chandler recently said depression and teen attempted suicides are so backlogged that there is not enough time in the day to treat them. Depression, isolation, hopelessness, despair. Where is the mental health support from ASD? It's invisible. How many 10-year-olds have to die? How many kids have to kill themselves before you put them first? How many? This isn't even scratching on how inadequate the virtual learning has been for most students. I'm sure you know kids aren't doing well virtually, and how can you even think they will be ready to go into their next subsequent grade level when this year they won't make any discernible academic gains, but rather the opposite, severe academic regression?
Kristen,
wash hands, wear a mask, stay home if you're sick, whatever you got to do to get them back in school.
Kristen, I'm sorry, your time is up, but thank you. Next up is speaker number 6. Catherine Cronlund. Catherine, are you with us tonight?
Yes, I'm here. Can you hear me?
Yes, we sure can. You have 2 minutes and the floor is yours.
My name is Catherine Cronlund, and I'm the parent of 2 children who are in the extended resource classroom in ASD. I'm incredibly proud and thankful for the work of my children's teachers, classroom aide, principal, and everyone else involved in their team that has given to help my children during these difficult times. With the increasing rate of high transmission from COVID-19 in the municipality of Anchorage, in-person learning is not safe or helpful. We need clear metrics from how you will decide to reopen schools, a clear timeline for how much notice will be given to parents, and a much more robust safety plan, such as 6 feet distance between children. While I understand the risk of getting COVID-19 is lower in children, it is not non-existent. It can easily be spread throughout families if children return to school anytime soon. I have serious concerns with schools starting anytime before January due to all the upcoming holidays, family gatherings, and increasing COVID-19 numbers. School personnel will spend a defined amount of time in confined spaces, so have the HVAC systems in all schools been updated? At the meeting with the Anchorage Assembly and ASD last week, several alarming issues were discussed that I had not been made aware of. First, the gaiter masks are not allowed. Second, children will not be allowed to talk while eating lunch. How can you successfully ask any young child around friends to not socialize? Furthermore, as a parent of a special needs child, you need to inform families of the do's and don'ts when returning to school and not give them a week and a half notice. My children require time to adjust to new changes in their routine and our environment. One of my kids will only wear the gator mask due to his sensory needs, so we need lots of time to get him to utilize something new. Please consider families like us who need more than a week's notice of all things pertaining to this pandemic. While online learning, children are safe and can talk with friends. If not being physically in school is such an issue, why isn't each and every school ready and equipped with a full-time counselor to go and address any significant issues? I implore the board to wait until after January to reevaluate starting school. Right now is not the right time to open schools. Oh,
Catherine, I'm sorry, your time is up. Speaker number 7, Megan Webb. Megan, are you with us tonight?
Yes, I'm here. Can you hear me?
We sure can. You have 2 minutes and the floor is yours.
Good evening. Thank you for this opportunity. My name's Megan Webb. I teach band at Wendler Middle School, and my son is a second grader in the district. I'm very grateful that he and his class are not being sent back to school next week. Lately, I've been thinking about an ASD required training I attended last year regarding trauma-informed practices. In one animated scene of a film we watched, a child was trying to cross the street while semi-trucks came flying by out of nowhere, causing her to be in a state of fight or flight. Of course, this was an analogy for the fact that if a person is in that state constantly in their daily life, it significantly negatively impacts their ability to learn and function. I know that district leadership wants us to keep this in mind in terms of our teaching practices, and I wholeheartedly agree with this approach. Fast forward to today, when ASD staff, students, and parents have no access to concrete guidelines regarding how the decision to return to in-person learning will be made. I understand the need for adaptive planning, but this lack of transparency breeds lack of trust, and it puts us all in a constant state of worry, uncertainty, and unpreparedness, aka fight or flight. This is unacceptable given what we know about trauma-informed practices. Additionally, when folks say they don't understand something that is being communicated to them, or that it doesn't address their needs, best practice is to listen and adapt your approach. This applies in the classroom as well as in the community. Please listen to folks who are asking for more information regarding the plans to move forward. Future plans regarding returning to in-person learning must be transparent, include metrics that can be referenced, and be safe and equitable for our vastly diverse students and staff. Please treat us with the same care that you want us to treat our students, and consider this as you come up with a clear and publicly available plan moving forward. Thank you.
Thank you very much. Next up is speaker number 8, Sarah Stone. Sarah, are you with us this evening? Sarah, if you can hear it, there you go. Are you there?
Yes, hi, this is Sarah.
Perfect. You have 2 minutes and the floor is yours.
Hello, I'm a K1 teacher at Rogers Park and a parent to 2 elementary students. My purpose this evening is to make the board and broader public aware of the significant number of pre-K through 2 students not planning to return to in-person next week. When surveyed 2 weeks ago, 70% of families in my K1 class did not intend to send their children in person on November 16th. School-wide, over 40% of Rogers Park K through 2 families were not planning to send their children, but did not want to leave their school community. Similar to national numbers, that 40+% of students at Rogers Park includes families from diverse socioeconomic backgrounds. This is not a splinter group. These families are not wrong for choosing to avoid the risks associated with COVID-19. Their reasons are as diverse as the families know, but they can all be traced back to COVID. Opening all of ASD's primary classrooms at once is a blanket approach. While it may attempt to meet academic and social needs, the blanket opening will leave a huge number of our youngest students without a connection to classmates or teacher. By delaying the 11-16 opening, the district has the opportunity to develop a plan for these children. I don't believe Calvert's a viable option for most families. Its poor reputation has dissuaded many from joining, even with adjustments that requires immense amounts of time to implement with primary children. More importantly, it can't provide the opportunities for connection that a classroom and teacher offer. In-person school had hoped to meet social and emotional needs of our students, but a blanket opening would have inadvertently cut off a large number of children. Delegating the responsibility of creating a plan onto principals and teachers isn't the solution. It's not feasible nor appropriate to ask primary teachers returning to in-person learning to actively manage online classes as well. Some students need and want to attend school in person. Some do not. In August, members of the community asked ASD for a targeted approach to opening schools. It was the right thing to do then, and it still is now. Listen to your community, to 40% of Rogers Park's families. Don't plan another blanket opening. Think outside the box, ASD. Creative solutions exist. Thank you.
Thank you. Next up is speaker number 9, Beverly Hardesty. Beverly, are you with us tonight? Beverly, if you can hear us, it's *6 to unmute. All right, we'll come back to speaker number 9. Speaker number 10.
Can you hear me? Can you hear me? Hello? Hello?
Hi, I show this as Tanya Reed, but Tanya, you're speaker number 41.
Hello, this is Beverly Hardesty.
Oh, okay, that's all right.
I was
You've got
trying
2
to
minutes
unmute, sorry.
2 minutes and the floor is yours.
Okay, thank you. Hi, I'm a teacher here in the Anchorage School District. I taught for 20 years in Florida and other places. And first, I guess my first thought or question is why at the beginning of the school year, which is, a while ago, but why didn't we ask all our families and all our teachers who wanted to go back and who didn't? Many teachers didn't know what was going on. We didn't know how school was going to look until the day we got into school for our first day of planning. Had we done those numbers, we could have possibly accommodated the teachers that were health risk along with our parents, and maybe never had to have purchased something like Calvert or try to put our 6th grade elementary students into APEX. I feel that if we do a survey that's just a yes or no approach and then look at the numbers, we might find a solution without going very far. We're not telling people that they're just being respectful. We're talking about their children's and these teachers' life and death. I'm only one teacher, and I'm also a special needs parent in the district. And going back to me didn't matter either way but it was a hard choice to choose. So I understand both sides of the coin. Now that it has been decided that we are not going back, we need to find a way to meet the needs of our most neediest students, whether that's 1-to-1, 2 to 3-to-1, home visits, whatever it takes. These students are not learning this way. This is not the way that they can learn. A study that I just read said that 7 out of 10 teens have mental illness struggles. 61% have experienced an increased feelings of loneliness. They're all struggling. I have several students and my autistic grandson in SEL that do not like to show their faces. They want to see their friends but can't. They were model students but now are doing nothing. This is across all grades and ages. We as a community need and must do this for our students to have success. Some suggestions would be to take an hour a day or Wednesday afternoons and work with these kids. Thank you.
Thank you. Next up is speaker number 10, Aline Whitney. Aline, are you with us tonight? Aline, if you can hear us, it's speaker number 6. Or yes, *6 to unmute.
I'm with you.
Yes, we can hear you now. Thank you. You have 2 minutes and the floor is yours.
Thank you so much. This is Aline Whitney. I'm the mother of a 1st grader and an 8th grader in the Anchorage School District. I'm also a family physician here in town, and I work in the clinical setting and in the hospital setting. And to members of the school board, Dr. Bishop and Jennifer Petronas, thank you so very, very much for all the work that you are doing to keep our students healthy and learning. I'm incredibly grateful. I also appreciate the decision yesterday not to return the students in person at this time because of the increasing numbers and the severely shorted number of adult ICU beds that we have in town. So thank you for that. As we think ahead towards solutions when we do want to get kids back to school. I heard a lot of discussion appropriately with the school board members this evening about how to bring parents along with that decision. And I have two specific recommendations that will help families like ours who would like to be back in the classroom but have some big hesitations surrounding COVID. One is that we make it explicit that if a case is identified in a classroom, that the entire class simply return to online learning for 2 weeks, and that we clarify that that is going to be the plan to families, because that would stop any transmission in the classroom. It would make students and families feel safer, and it would help teachers feel safer as well. And then the second is that we work really hard on that 3-foot spacing. Some recent CDC data did show that children even under 12 can transmit the virus to 50% of their household contacts. And the 3 feet apart really wouldn't be adequate for that. Again, thank you so much for all of your efforts, and I look forward to hearing additional plans and helping in any way that I can.
Thank you. Next up in person, speaker number 11, Judy Elledge.
Hi, can you hear?
No, not very well.
Hi, my name is Judy Norton-Elledge, and I'm a retired teacher principal and currently under contract with the Department of Education to develop the K-2, K-3 literacy plan for the state of Alaska. With Alaska dead last in reading in the U.S., I cannot even imagine where we are today with the insistence of our largest school district to not return to in-person school. I will be presenting the board president tonight a petition with over 800 signatures from Anchorage to reopen our schools with the research data we have used, and I'll email it to her to send to you. Concerned parents of this petition are asking that ASD to begin an in-class school immediately, or at least give parents a choice. Schools all over the United States, the world, and even here in Alaska, just an hour up the road, and all our private schools are attending school in person. In the state of Florida and Texas, they have over 800,000 people with COVID or have had COVID, and they are all in school. ASD's remote learning negatively impacts children, not the teacher's faults, but for the following reasons, children in Anchorage are best served by attending school in person. We are also concerned about the equal education opportunity, and I think Mrs. Hildy spoke very well to that tonight, so I'm not going to repeat that. But where remote learning is often plagued with challenges in low-income families, higher-income families have additional options for furthering their children's education, and most of them are not testifying to you. Some families have opted to send their children to private schools, hire private tutors, or hire private teachers. Not all families can do that. The education gap that exists in Anchorage is going to be even more exaggerated. Just contrast students with remote schooling for a year, with many students not even attending, their parents cannot speak English, to those who have been privately tutored. The obvious disparity dictates immediate action. There's also the emotional, social, and physical impacts, and the reasonable precautionary measures, which I think Dr. Bishop has gone over and beyond. So I'm going to end mine tonight with the following questions. Are teachers required to report?
Judy, I'm sorry, we're at the 2 minutes.
Oh, I'm sorry.
Yeah, thank you. And I'll watch for your,
I didn't hear the bell for those.
Thank you. I'll watch for your email. Next up is speaker number 12 on the telephone, Gaynor Freeman. Gaynor, are you with us tonight?
I am.
Thank you. You have 2 minutes and the floor is yours.
Hi, I'm speaking as a parent today, not an employee. It is not the children's responsibility to make sure that you have hospital beds for when there is a 99.5% survival rate of having COVID. I'm going to tell you, I hear fear, fear, fear from everybody that is speaking today. I've listened to 2 hours of the school board and the superintendent, and what I hear is that mask work, safety precautions are in place, and I have had COVID, okay? It is survivable. I know there are the numbers that are at high risk. My son has asthma. I exposed him to it, and I can't go into my office every day because I need to stay home with my junior in high school to keep him awake through Zoom sessions. So I telework most of the time.
With that, I'd like to speak for the not protected by a union. All students are not protected by a union. Give the parents a choice. There are parents that have lost their jobs because they need to be home with their kids, those who have lost their jobs because of business closures. There are vulnerable populations like those in poverty and special needs that need to be face-to-face in education. Students need to come first. This has gone on long enough, 8 months. Our kids have not walked into school buildings. Kids are suffering. My son is suffering. He has ADHD, and it's really hard. He's broken down. He's begging to go back to school. I don't want him to become a statistic. This is ridiculous. We won't know the damage we've done to these kids for many years to come. Their mental health is suffering. Behaviors are changing. Social skills are lacking. Literacy of our little ones is in jeopardy. Children are not the cesspool of COVID. They are at low risk. Yes, I know there are those with serious medical conditions like my son who has asthma. Give parents the power to make the right choice for their families. Families should have the choice, not the ASD or the school board or the unions. The majority of teachers, yes.
I'm so sorry. Your time is up.
Thank you.
Thank you so much. Speaker number 13 in person, Thomas Pease.
My name is Thomas Pease, and I teach at Mears. First, thank you to Dr. Bishop and the board for postponing the reopening of some school buildings on November 16th. The viral spread is too great to assume such a risk, and I'm relieved that ASD reached that conclusion as well. Leading an organization of this size through a pandemic is a challenge bigger than any earthquake or any budget cut. I appreciate your sincere desire to do what's right for students, even when we disagree. Now that we have some additional time to plan for an eventual school reopening, we need to recognize what we shouldn't do and embrace what we need to do. We shouldn't continue to change the risk thresholds for in-person and online learning. Moving the goalposts does not build confidence within the school community. We do not need to be in a hurry to name a new reopening date, which could cause more stress and chaos in the community. The virus is unpredictable, and we need to let data define our reopening date. We should not view 50% of fire capacity as a gauge for safe classroom learning during a pandemic. It sounds good, but fire capacity numbers far exceed class size, and it's nonsensical. How are fires and viruses even remotely similar? We need to conduct testing, temperature checks, and contact tracing in every building. We need to assess air filtration in every building and upgrade those shortfalls. We need to acknowledge that ASD workforce is representative of society at large, meaning about a third of us are highly vulnerable. We need to place a higher value on long-term human health care than we do on short-term standard test scores. We need to on learning, while imperfect and sometimes frustrating, is a safe and viable alternative for many of our students. We need to recognize that we collectively, as the Anchorage School District, should protect the elderly and the infirm, minority groups and cancer survivors, expectant mothers, and our own workforce. And if we can't do that, then we need to keep our schools closed for our children, because every one of our students is connected to someone who is vulnerable.
Thank you.
Thank you.
Speaker number 14 on the telephone, Kathy Gallagher Curtis. Kathy, are you with us tonight?
Hi, yes, I am.
Thank you. You have 2 minutes and the floor is yours.
Thank you. And first of all, thank you for this opportunity to allow us to speak. I retired in 2015 from the Anchorage School District after 33 years of teaching. It was an amazing career and I absolutely loved it. I was called into my old teaching position in March and I'm still subbing there today. Apparently I'm failing at retirement. I've taught a lot of children in my years of teaching and I've seen many things transpire in those times. I had one year when the annual flu was really bad. I had 10 students absent from my class for 3 days. That was almost half of my class. We didn't close schools. Everyone continued to learn and be mentally and physically healthy. We socialized, we sanitized, we washed our hands. Statistics continually show that the majority of healthy people who contract COVID get sick and recover.
The mental health needs and education of our students far outweigh the risks of COVID-19. We are destroying our children's mental, emotional, social, and physical health, as well as denying them the education they deserve and need by not allowing them to go to school. How long is this going to go on? COVID will not go away anytime soon. This virus could be around for 2 years or more. Are we going to educate via Zoom for years? There is a solid, well thought out research plan in place. This plan allows for parent choice. Students may attend face-to-face or online via ASD virtual. Right now, parents do not have a choice. It's time to implement this plan. Teaching isn't about standing up in front of kids and talking. It's about seeing their faces, reading their body language. How are they sitting in their seat? Are they attentive? Are they getting it? We can't see any of this on Zoom. I'm teaching kindergarten. I'm looking at 2-inch pictures of cute little faces on a screen. I can't tell if they're sitting properly, understanding concepts, doing their work. Zoom is inadequate. The kids need to be in school. I can tell you that the majority of teachers are only teaching about 25% of what they normally do. I implore you to get our students back in school. Implement the plan that's in place. Otherwise, our society will have a lot bigger problems than COVID.
Thank you so much. Next up, speaker number 15, Marnie Hartel. Marnie, are you with us tonight?
Hello, this is Marnie.
We can hear
Hello.
you. You have 2 minutes, and the floor is yours.
Hi, my name is Marnie Hartel, and I'm speaking as an individual. According to Sunday's daily case count, Anchorage is at a rate 7 times the Alaska state threshold for high risk level, placing our city within the top 8 highest case counts of all states in the nation. I lie awake at night as a teacher. I'm knowing my students and their families are struggling to make ends meet, put food on the table each day. And I'm so sorry this is happening to all of us. My friends and neighbors, we've made tremendous sacrifices. I want to be back with my students in the classroom as soon as possible. I also want to ensure that their return is safe, that they won't pick up COVID at school and transmit it to elderly family during the holidays. So I thank the superintendent and the administration for making those hard decisions at this time. Presuming that school spread will not increase community spread is preposterous the moment you ask students to eat together in a room with their masks off. Case counts will probably balloon at that point, and local hospitals are already overwhelmed with the staffing. If we should return to school without a vaccine, let's start with a shortened in-person duration, maybe releasing students before lunchtime while providing a packed lunch. And I know there's discussion about the district plan being clear, but last week, most schools held staff meetings to brainstorm ideas for mitigation. Staff are rushing to buy PVC pipe and shower curtains and Pinterest ideas. Are we resorting to the advice of Pinterest and not pediatricians? There's no clear guidance that's medically backed, giving us advice on how, as educators, we should uniformly set up our classrooms. So the biggest thing is the district doesn't have a secure plan for substitute teachers. So the staff and students in and out of school with quarantines or isolation time, we're going to sacrifice a lot of continuity of learning. And staff will not be able to teach lessons online and still manage the setup, cleanup, and lesson in person. Anyway, public health is a community responsibility. You all know that, and schools are not safe to reopen this month. And I really appreciate the school board. Thank you so much for hearing my testimony. Thank you.
Thank you. Speaker number 16 on the telephone, Kaya Kaltenborn. Kaya, are you with us tonight?
Hello, can you hear me?
Yes, we can. You have 2 minutes and the floor is yours.
Thank you. Hi, my name is Kaya Kaltenborn. I am a parent of a kindergartner and a 3rd grader, a wife, and I have been a teacher in the Anchorage School District for 20 years. I'm also a national board certified teacher. I teach because I want to make a difference and empower youth to fight for their American dream. There are many viewpoints to be heard tonight, and I want to say thank you for listening to each one. I fully agree and support the decision to not send our youngest students back to school while the numbers in our community are so high. The matrix clearly shows that we do not have community spread under control. To send students back would be a reckless decision, a decision without regard of the consequences. I want my students to come back. I want my kids to go back when our adult community has this under control. Like it or not, as you've heard tonight, it's often left to our schools to solve our community's problems. So now I call on my fellow Anchorage residents, man up and mask up. As you have heard tonight, it's adult transmission. Smile under your mask. Show off your clean hands by waving instead of leaning in for a handshake. And remember that you're being heroic by wearing your mask. You could be saving a life. You could be sending a kid back to school. Toughen up, wear the mask, and don't go where you don't have to go. When we look at our mitigation strategies and how we present ourselves to the city, let us say we are ready, not we will be ready. I am confident in my school's mitigation plans. I want to be confident in my community's ability to keep this under control. Mask up, Anchorage. Thank you.
Thank you. Next up on the telephone, speaker number 17, Axel Copen. Axel, are you with us tonight?
Yes, I'm here. Can you hear me?
Sure can. You have 2 minutes and the floor is yours.
Thank you. Thank you for this opportunity to speak here today. I'm a father of 3 children who attend ASD schools. I have family and friends who are teachers in ASD as well as all around the state, and I myself have worked as a long-term substitute teacher. I'm well aware of how our schools work. Going to school is certainly not like a short trip to the grocery store. Instead, you're asking multiple people, some with serious health issues, to stay together for hours at a time. As much as my kids would love to be back at school, they know it shouldn't be an option to fill our classrooms until COVID-19 infection rates have dropped to a safe level. They simply do not feel safe returning to school under the current conditions. That statement is true whether we are discussing returning to school now or in January if COVID-19 infection rates are still excessive. And that's regardless of who is infecting who. I seriously doubt a parent, spouse, or child will be comforted knowing that a loved one lost to COVID-19 was infected by an adult instead of a child or vice versa. I am confident that a child who loses a parent to COVID-19 will not be better off because they physically attended school. Board members calling out teachers to be held accountable because they fear COVID-19 does not add credibility to this process, by the way. And I have not heard much about ASD's accountability if even one child or teacher dies. Instead of wasting valuable time and energy and creating even more uncertainty and stress for teachers, students, and their families by obsessing on in-person learning, ASD needs to focus its energy, time, and resources on maintaining continuity and stability for these students and to further improve online learning, especially for those few who may be struggling. The focus needs to be on improving online teaching practices and reaching out to those who are struggling until this pandemic has subsided to a level where it is safe to resume in-person learning. In closing, since reopening schools directly affects our community as a whole, I suggest that a committee be formed that involves all affected parties, as well as Dr. Ann Zink, in any decision to resume in-person learning in ASD. Thank you.
Thank you. Next up is speaker number 18 on the telephone, Jacob Barrett. Jacob, are you with us tonight?
I am. Can you hear me?
We sure can. You have 2 minutes and the floor is yours.
Hi, my name is Jacob Barrow. I'm a parent and another national board certified teacher. My children and yours will be in the safest environment possible if they're in a classroom where students are less than 6 feet from one another. As a teacher, I'll be in a classroom with 3 different groups of students, less than 6 feet for 90 minutes at a time. I'm not asking for predictability or that my classroom is 100% safe, but the current plan is unnecessarily putting more students and staff at risk, or at a minimum increasing the chance more students will miss school because they are close contacts. A school board member tonight said, "I don't know what better plan you could put out there." The problem is teachers and nurses are reading that plan. They're working to implement it in their classrooms, and we're raising serious concerns. I have tried to share an alternative I feel will support our youngest and most vulnerable students by building trust and opening schools safely. One that addresses concerns by staff and in particular our school nurses who are on the front lines. We need a plan that looks ahead to the reality that our community is likely to face similar, if not higher rates of COVID-19 in our community in the next several months. We have to work backwards from what we've done so far. Social distancing in classrooms is a key issue. We have to give teachers time to assess how many students they can serve with 6 feet of social distancing in each classroom and give principals time to look for innovative ways to accommodate students. Concurrently, staff must work with families to identify and prioritize those students who need in-person instruction the most, and then bring them back up to building capacity while others continue online. Teachers have solutions, and I'm happy to share more. I'm willing to work together to get our youngest and most vulnerable students back in school safely as soon as possible. But concerns from staff and nurses have to be addressed in order for us to build trust and be successful. Thank you.
Thank you. Next up is speaker number 19. Is Chad Garner here in person with us tonight? All right, seeing a head shaking of no. Speaker number 20 on the phone, Soren Worth. Soren, are you with us tonight? Soren, it would be *6 to unmute if you can hear us. All right, we'll come back up to Soren. Try again in a few minutes. Speaker number 21, Mary Richards. Mary, are you with us tonight? Mary, can you hear us? One more time. I saw you trying. *6.
Okay, can you hear me? Can you hear me now?
We sure can. Thank you very much. You have 2 minutes and the floor is yours.
Sorry about that. So I came with a scripted narrative to read, but I have to just say to everyone that I'm really impressed with the high level of conversation that's going on tonight. I really want to give a shout out to school board member Bellamy when she said that you are more than a school board. You're actually a community. And this is the thing that I talk with my students about all the time, my AP students. We are existing in discourse communities all the time, and we can't underestimate the power in that, but also we have to get out of our own perspectives and bubbles and be able to throw ourselves out and see the larger rhetorical situation. There have been a lot of contentious things happening in our greater society, and our communities and our districts and our buildings become microcosms of all of those same tensions. I understand that it's frustrating to hear that teachers get scared, but when we have leaders in our own community, like assembly members, thwarting and undermining assembly mandates and flaunting mask wearing and social distancing, that gets scary, and it's scary for all of us. So I really want to see the school board help not only our district, but the entire community build greater amounts of trust. I really like what school board member Holloman brought up in terms of the transparency. It's more obvious to me tonight that you all have been having a lot of conversations, but you haven't been transparent enough, so we're not seeing those conversations. Friday, I was at a meeting, and I was told that, and this was on a day when, cases were over 500. I was told that when high schools return in January, am I over?
Yes, I'm sorry, you hit your 2 minutes.
Thank you.
For calling in. Next up is speaker number 22, Danielle Kovaric. Danielle, are you with us tonight?
Hi, can you hear me?
We sure can. You have 2 minutes and the floor is yours.
Hello, my name is Danielle Kovaric. I am a teacher and a parent of 2 school-age children. I have worked in the Title I school for 15 years and love the community that I work with. Many of them are like family. Because of this, I'm here to say, please, hear us. Listen to understand, not to respond. Trust is a problem in our district right now. That trust is further broken every time we testify and then listen to our testimony be misrepresented and negated. We hear don't bully and spread misinformation, but we feel that we are being bullied and that the district is spreading misinformation, or we wouldn't be voicing our concerns about a job that we all love. It is very concerning the way that teachers are spoken about at these meetings. I feel for teachers that are concerned for their students. I am one of them. I am also a parent, and I feel for parents that are struggling through this right now as well. Why is it that we think that sending our kids back to buildings that 50% of the time do not even have a school counselor present is really the best answer to our struggles? Where is our leadership on finding new and innovative ways to support mental health online and to reach out to families that we have not been able to reach? What I have seen this school year is principals and directors pressured to create plans that they knew were not really safe or sustainable. They were forced to create plans that had to either be about what's right for kids for learning or what is safe, not both. And oftentimes safe is not really an option yet because supplies are not available or are still on order and staff are limited everywhere. So where do these plans land? On teachers. We know it is right for kids to be in schools. We agree with you. But the reality is if we can't keep them safe, it is not possible to help them learn. In closing, I will use the words of one of my dear friends, who is one of the most amazing kindergarten teachers you have ever employed, and also one of the teachers forced into retirement for safety this school year. What is your teacher's first job, she would say, and her students would always echo back, to keep us safe. Thank you.
Thank you. Next up is speaker number 23, Christina Hunter. Christina, are you with us tonight?
Hello.
Hi, we can hear you. Have 2 minutes and the floor is yours.
Thank you. Dr. Bishop and School Board, thank you for the opportunity to address you this evening. Although my testimony is similar to my peers, I'm speaking to you as a teacher and as a parent. I do believe that when more voices are heard, the better understanding a governing body has. Our collective journey began 8 months ago, nearly to the day, when all persons in our community were asked to make personal and family sacrifices to keep our community safe from the novel coronavirus. There have been food shortages, things missing off shelves, and toilet paper still seems to be missing. We have foregone birthday parties, slumber parties, get-togethers with friends, and had to use creative means to visit with people outside of our small social bubble and trust that others are doing their part. While I commend the district's decision to choose to postpone the start date for our pre-K and our second grade students, our self-contained special education students, and those at Whaley, I would be very dishonest if I did not state that I have felt bullied and coerced by the district's previous plan to return to school buildings. I know, like my family, many of my peers have sacrificed too much for our collective sacrifice to be dismissed by the governing board of our district. While I deeply desire to return to the classroom, that desire does not supersede the necessity to keep my family, my students, their families, and myself safe and healthy. I implore that the school district continue to hold our academic delivery system to online via Zoom and Canvas until we have concise and vigorously followed mitigation controls where social distances of more than 3 feet, really 6 feet, between students are followed and expected. And when there is a concise matrix of how we can safely enter the school buildings for face-to-face delivery. Thank you.
Thank you. I'd like to give an opportunity to go back up to speaker number 20, Soren Worth. Soren, are you on the line with us tonight? Soren, if you can hear us, it is *6 to unmute. All right, we'll keep going down the list. Speaker number 24, Alyssa Logan. Alyssa, are you with us tonight?
Hi, can you hear me?
We sure can. Thank you for joining us. You have 2 minutes and the floor is yours.
All right, thank you. Hi, my name is Alyssa Logan. I'm a teacher at Chugiak High School, but more importantly, I am a parent of a first grade student in the Spanish immersion program at Chugiak Elementary School. I'd like to start by thanking you for the decision to delay the start of in-person schooling at this point in time. While my family and especially my daughter are looking forward to a return to in-person schooling, we were looking at the difficult decision of switching her program halfway through the year to the virtual program.
With cases rising and our hospitals on the brink of being overwhelmed, this was the responsible decision. I also would like to urge you in your future planning to use the metrics based on science that you previously put out as your guidelines. When we started out the school year, we were asked to make a decision where to place our child based on our needs and comfort level. When my family made this decision, we looked at the metrics that the district put out as a guide to when we would return to in-person schooling and decided what we would feel comfortable with by weighing the costs and benefits, as many other families did. We chose to go to in-person schooling with the understanding that the district would be guided metric put in place at the beginning of the year and would only send kids actually back to school when it was safe to do so. Then it was decided that they needed a more holistic approach and changed to a different metric that was not the agreement we first made when we decided to send our child back to in-person schooling. While I understand taking a more holistic approach, lately I've grown concerned that even this will be disregarded and we will see a return to in-person school regardless of what the numbers are. I urge you to take a science-based approach and make decisions based on the numbers of cases in the community. Families, including ours, made the decision regarding their students' education for the year based on the metrics provided by the district. Throwing it out the window means that those families then have to decide between sending their child into an environment they do not feel safe about and changing their children's whole educational system to new teachers and, more importantly, new curriculum. And as an immersion parent, we don't have the option of doing Spanish in the virtual program. We have found something that worked for us, as have many families around the district. And I want to recognize the hard work of my daughter's teachers and the many teachers around the district who are working hard to make learning happen online, because it is happening. I see it every day in my daughter and in her classes. I ask you to honor the agreement that you made with teachers and families at the beginning of the year. Thank you.
Thank you. Speaker number 25, I don't see in person, so I'm going to go to speaker number 26 on the telephone. Chris Sandhoffner. Chris, are you with us tonight? Chris, it'll be *6 to unmute if you can hear us.
Hello.
Hi there. Is this Chris?
Yes, this is.
All right, perfect. You have 2 minutes and the floor is yours.
Thank you. Good evening. Thank you for your recent decision to postpone the return to in-person learning in our district. I am a middle school teacher and parent in the ASD. Before the decision is made to return in person, please follow the science and matrix that was originally proposed on the ASD website. Please provide clear metrics based on sound science for how the decision will be made to reopen schools. Please recognize that COVID numbers within our community must be consistently low to consider a safe return to in-person learning. Please include ASD schools in any and all municipality orders. Please create a robust safety plan that ensures lower class numbers where students and teachers will maintain at least 6 feet of social distancing and masks will be required to be worn at all times. Please ensure equity in access and funding across the entire district in terms of PPE, student dividers, and other class and school-wide safety needs. Please share if the data you are referring to in terms of students not spreading COVID to others is based on schools practicing 6 feet of social distancing or the 3 feet that is deemed acceptable by the Anchorage School District. Thank you to our students and families for working so hard to embrace and support this new format of learning. Thank you, teachers, administrators, paraprofessionals, and Totem employees for your continued dedication, effort, and teamwork to meet the needs of our students. Together, we will continue to provide the very best for our students while ensuring the health and safety of students, families, school staff, and the community. Thank you.
I do not see speaker number 27 on the line. I'll keep an eye out for this person. Next up, speaker number 28, Reed Davidson. Reed, are you with us tonight?
Yes.
Thank you for joining us. You have 2 minutes and the floor is yours.
All right, thank you.
Good evening, everyone. My name is Reed Davidson, and I'm the immunosuppressed daughter of a first grade teacher. Thank you for being here to listen. I would like to start off by thanking Dr. Bishop for delaying school opening. It was the right choice in my family, and I extend our gratitude. Tonight, I would like to ask for a few things. First, I request that you delay the school opening until at least January rather than giving 2-week updates. Our community is hurting. We have a growing number of cases in Anchorage. On Saturday, there was a record number of cases, 604. We have to give it time to heal before we toss thousands of kids, teachers, and families into the ring. We should wait until at least January past the holidays. I also request that you put out solid metrics about when and how students and teachers will be pulled in and out of schools, and I request that you pick one that you will not change unless absolutely necessary. My third request is that you give teachers appropriate PPE and classroom supplies. The school district has never told my mom that they would provide N95 masks for her or reimburse her for the N95 masks that she must purchase because she must protect herself or her medically compromised daughter. There are teachers in my mom's school that do not have enough classroom supplies or space to distance their students. They are worried and trying to adhere to the guidelines with limited success. If you're planning on setting them back, you should at the very least protect them. Finally, I strongly urge you to think of other ways to connect students and create supportive environments without tossing them into risky schools. As a student, I don't think that putting students back in school is a good choice for their mental health. I think it would be torturous to have to stay in your sterile prison, having to be so close to your friends, but feeling so emotionally far with your separated materials and limited interaction. I think there are other better choices. Thank you for your time.
Thank you. Next up, I believe it's going to be speaker number 30, Kate Cannon. Kate, are you with us tonight?
Hi, can you hear me?
We sure can. Thank you for calling in. You have 2 minutes and the floor is yours.
My name is Kate Cannon. I'm a parent and proud staff member at Tyson Elementary. I would like to thank you for the decision for canceling the return to in-person school. Like ASD, my sister's school district fought to get preschool through 3rd grade back to buildings by the end of first quarter. After 4 weeks, they're doing an about face, returning to distance learning, and have committed to remain there until the end of the entire school year. My heart broke as she told me, and I quote, "My students and our staff are dropping like flies."
I think we may have lost our speaker. If she calls back in, Kate, we will watch for your number and come back to your testimony. Want to try and go back up to speaker number 20, Soren Worth. Soren, are you with us tonight?
Hello. Hello.
Hi, we can hear you. Thank you for being patient. You have 2 minutes and the floor is yours.
Wonderful. Thank you. Good evening. My name is Soren Worth. I'm a language arts teacher at Diamond, and I'm representing myself tonight. I'd like to say thank you for reconsidering reopening schools, and I would like to recommend online learning continue through at least spring break 2021. Given our context and almost exponentially increasing number of cases, mounting pressure on an already weakened public health system, a proclivity by some to eschew mask wearing in the name of freedom, and a society that prizes individualism over community, opening schools would be a disaster. In the United States, we are approaching 250,000 deaths from COVID. Meanwhile, students, teachers, and parents are becoming more comfortable with online learning. While imperfect, it's a new routine and it's shaping our lives in a fundamentally different way. There are silver linings. I can say that my students are writing with more authenticity, more stamina, more voice, more creativity, and more clarity than I've seen in 15 years of teaching language arts. Students have to use writing to communicate more with their teachers and with one another. We are all making adjustments, and we need to see in this transition an opportunity for fundamental changes in the way we educate children, smaller learning pods, phenomena-based learning, experiential pedagogy, relevant and engaging and emerging curricula. The pandemic doesn't allow us the privilege of going back to normal, trying to pretend it all away. Instead, we should reimagine education and go forward to a better normal. I leave you with the words of Albert Camus, author of The Plague. Our townsfolk were not more to blame than others. They forgot to be modest, that was all, and thought that everything was possible for them, which presupposed that pestilences were impossible. They went on doing business, arranging for journeys, and formed views.
Soren?
How should they have thought
Sir?
to think of anything like a plague? Thank you.
Hi, Soren. I'm sorry, your 2 minutes are up. Thank you for calling in. I do want to go back to speaker number 30, Kate Cannon. She called back in. Kate, are you with us tonight?
Yes, I'm here.
Hi. Okay, thank you for calling back in. If you can go ahead and just start over at the 2 minutes, go ahead when you're ready.
Thank you. Like ASD, my sister's school district fought to get preschool through third grade back to buildings by the end of first quarter. After 4 weeks, they're going to do an about face, returning to distance learning on the 16th, and have committed to remain there until the end of the entire school year. My heart broke as she told me, and I quote, "My students and our staff are dropping like flies." As a parent of 4 ASD students, I share the frustration of families who long for education to resume the way it was. As an educator, I know returning to the buildings will not and may not ever look the same. Not all schools have the room, staff, desks, or materials needed to provide the same level of safety for every family. We do not need more areas in education that are not equitable. ASD has widened the gap between our schools. Our community needs to see there are disparities when it comes to class sizes, PPE, and school safety plans. Families need to be included in the conversations about when and how students should return to buildings. School staff are working tirelessly, being asked to provide engaging educational lessons online, and they are completely up to this task. Students and staff have adapted to new schedules, expectations, and methods of learning, and students continue to grow in their current virtual environment. I've seen it every day, working with staff at my own school or watching other ASD staff interact with my own kids. We need long-term decisions we can run with. We need to keep continuity that gives our students the chance to excel. Our families deserve nothing less than the best the community has to offer. I believe we as a district can do better. Let us put our focus on providing excellent education and care instead of dividing our focus between our students and our classrooms. A class is its students, not its physical location. Thank you.
Thank you. Next up, speaker number 31, Mandy Mercurio. Mandy, are you with us tonight?
Yes, I'm here. Can you hear me?
We sure can. You have 2 minutes and the floor is yours.
Hello, my name is Mandy Mercurio. I have 2 children, one currently enrolled in ASD, and I fully support opening these schools. I'd like to say that none of the options offered during this time has worked for my child. My daughter has some learning disabilities, and only this year did I gain important knowledge of her vision and some neurodevelopmental disabilities. I thought homeschooling would be a good alternative for her during this time, but she is not succeeding. Online learning is not working for us, nor will it become more comfortable as time goes on. A computer screen only exacerbates her vision insufficiencies, and in the meantime, she makes 0 gains and only gets more and more behind. I am trying, but all of this is not working. My daughter needs to process, socialize, and be active. The classroom and school schedule will accomplish this for her. And one more thing that I would like to add is that keeping children home and isolated in fear has killed more children than this virus. Thank you for your time.
Thank you. Is speaker number 32 here in person with us? Andrea Gardner. All right, seeing a head nod of no. Looks like, let's see, have to skip a few. Number 36. Daniel Kemp. Daniel?
Hey, can you hear me?
Speaker number 27 is not in the queue. Yeah. All right, we can hear you, sir. You have 2 minutes and the floor is yours.
All right, thank you. Good evening, everybody. My name is Danielle Kemp. I'm a retired Army combat officer, teacher here in the ASD, and I'm a concerned parent. I want to say off the bat, I am very glad that the district has decided to reverse course on reopening classroom lessons. I believe this move will help keep our community safe. I would also recommend keeping schools online until after spring break 2021 or the end of this school year in May 2021. Schools are a part of our communities. You know, what happens in one part of our communities affects all the other parts and vice versa. Now, I must say, though, that I am very upset and disappointed that in the face of all scientific and medical evidence to stay away from public gatherings, this district pressed on. What I've heard from some in this body is just carelessness, borderline reckless endangerment. I'm just being honest here, okay? We didn't just now enter this extremely high category for COVID-19. We've been here for the last few weeks. The decision to go back to classrooms was made weeks ago and just now changed. This is a demonstration of poor judgment. You know, you were told that this was a dangerous move for weeks, yet you persisted. And you're acting brand new about, hospital beds, but you knew that ICU and non-ICU beds were starting to get low, yet you marched ahead towards danger. You were informed that our teachers, parents, and especially kids, need consistency, yet here we are dealing with uncertainty for quite a while now. The CDC put out, and people kept telling you time and again, that over 80% of COVID-19 deaths are of children of color. Yet you were willing to throw out black and brown babies, in the fire, sacrificial lambs in this foolish endeavor. Okay. So before I go, though, I would like to wish everyone an early happy Veterans Day, especially to our educators who have served our country with honor and dignity. Thank you.
Thank you. Going back up, we had a couple callers right before him. Speaker number 34, Kayla Page. Kayla, are you with us tonight?
Can you hear me?
We sure can. You have 2 minutes and the floor is yours.
Okay. My husband and I are both elementary teachers in ASD. I cannot tell you the weight that was lifted off our shoulders when we learned that face-to-face start had been pushed back. For now, we can put off thinking about making some of the hardest decisions we never thought we would have to consider. It is so hard to know what to do. The truth is there's no good options for teachers who feel unsafe to return face-to-face. I want you to know that we love our students, we love their families, and we work so hard. When discussing and considering solutions for this life-changing decision when to reopen school buildings, these kinds of decisions shouldn't be made lightly or quickly. People are so concerned. We've lost teachers to resignation and retirement. Our students are bouncing back and forth from ASD virtual to the in-school online. Teachers are dealing with enormous pressure from the district and the community. We frequently take criticism on a national level, as well as from individuals who don't know what my job entails. I have learned that being undervalued is unfortunately part of this job. And teachers right now are crushing it. The parents that I interact with are invested and the kids are learning. We thrive with consistency, especially in such uncertain times. I ask you all that you have empathy and an open heart when making these decisions, and you listen to science and you continue to keep our best interests in mind. And this is from a speech I heard on Saturday. We cannot repair the economy, restore the vitality, or relish life's most precious moments, hugging a grandchild, birthdays, weddings, graduations, all the moments that matter most to us until we get this virus under control. And this is very much includes the reopening of school buildings for face-to-face instruction. Thank you.
Thank you. Up next is speaker number 35, Elizabeth McGee. Elizabeth, are you with us tonight? Elizabeth, if you can hear us, *6 to unmute.
Can you hear me now?
We sure can. Thank you. You have 2 minutes and the floor is yours.
Good evening, school board members, Superintendent Bishop, and community members. My name is Elizabeth Congdon McGee, and I am the current acting executive director of the Alaska School Counselor Association and a school counselor with ASD. Change is hard for all, especially our students, as we continue to monitor the numbers of COVID and work towards a safe return back to school. Some of the issues that have been discussed during the pandemic that do affect us as school counselors is communication and mental health. It will be important for you to encourage administration to communicate on processes so not to have the frustration of staff, students, and families continue. School counselors need to be able to direct families and advocate for their needs in order to help students progress and not fall behind. This all comes down to making sure school teachers are on the same page as the administration when giving information out. Mental health is another aspect that has been shared with the community as an issue in our young people. Although school counselors play a big role in mental health, we are not therapists and should not be expected to do that in our role. With the limited amount of availability out there, kids are needing that extra support from school counselors, but we are not going to fix the mental health issues that our students face. School counselors can only do what we do best, and that is be there for them, listen, help them on a day-to-day basis by providing coping strategies, social emotional skills, and techniques to continue to move forward. We are human and have the same anxieties, fears, uncertainty as our colleagues and students, but they still come to us for comfort and solutions. Our school counselors need to be kept informed so that they can adequately do their job. We want the best for our students, families, staff, and community, and we are the bridge that connects all these entities. We do so much more than scheduling. Please keep the bridge intact and see our school counselors as the leaders that they are. We have phenomenal school counselors in our district at every level. Thank you.
Thank you. Next up is speaker number 37, Mitchell Page. Mitchell, are you with us tonight?
This is Mitchell.
Yes, sir. You have 2 minutes. Yes, you have 2 minutes and the floor is yours.
I'm a teacher here at ASD, and I believe it's our duty to provide an education to students. I also believe it's our responsibility to protect them. As COVID-19 numbers rise in our city and communities, the risk of transmission increases. The likelihood that students and staff will bring COVID into the schools is highest when community spread is highest. While the Anchorage School District has worked to implement mitigation strategies and cleaning procedures, nothing is perfect and nothing is guaranteed. We must also continue to improve upon them and make them better. Last summer, I began a graduate certificate program with UAA, and during my studies, I've been looking into barriers that families face that hinder their ability to be involved in schools. One of those barriers I found is health. I'm concerned that reopening while COVID cases remain high put our most at-risk families in harm's way. Families that already struggle to be part of their students' school life will be further affected by COVID-19 and its lasting effects. I say this because the research provides us with the knowledge that family involvement is directly related to student success. We need to protect the health of those families already having a difficult time finding ways to be involved with school. We don't know how much longer COVID-19 will be in our community. We continue to have the opportunity to put our students and staff's health and lives as our priority. As any educator knows, Maslow's hierarchy of needs has to be met before any real learning can happen. Choosing to remain online is a choice to protect student and family's health and student and family lives. We are going into the 9th month of living with COVID-19 in our community. It's exhausting. The hard truth is that we must persevere. We must choose to protect our youth. We must choose online over in person because it protects our schools from a global pandemic. Thank you.
Thank you. Next up is speaker number 38, Mandy McConnell. Mandy, are you with us tonight? Mandy.
Hello?
Hi, we can hear you. Thank you for calling in. You have 2 minutes. The floor is yours.
Good evening, Dr. Bishop and members of the school board. My name is Mandy McConnell, and I'm a parent of 2 children in ASD and also a 14-year teacher within the district. I originally planned to speak about my concerns with opening in-person schooling when the transmission of COVID-19 continues to vastly spread within our community. With the recent update we all received about the delay, I'd like to instead thank you for taking into consideration what is occurring in our community and making the choice of keeping the safety and health of our community in the forefront. Although I have been looking forward to the day I get to be in person with my class, the massive spread of COVID-19 has instead brought on anxiety and stress. It is important that we have better control of this virus within our community before we send students and staff into buildings. As we move forward, we must ensure the 6-foot social distancing in the classroom, and especially during lunch when masks are off. Social distancing of 3 to 6 feet or greatest extent possible is unacceptable as a mitigation process. And I encourage you to relook at the school plans that fall into this category and correct the necessary social distancing our health leaders continue to promote. With this delay, I hope our community will take the time to work towards bringing the transmission of the coronavirus down so that we may all return to school in person in a safer manner. Thank you.
Thank you. I don't see speaker number 39. However, speaker number 40, Heidi Sukata. Heidi, are you with us tonight?
Hello.
Hi there. We can hear you. You have 2 minutes and the floor is yours.
Thank you. First of all, I want to say thank you to board members Holloman, Bellamy, and Mitchell for listening to educators and consistently trying to protect our students, families, and community. I very much appreciate the decision to postpone face-to-face learning. It's my hope that pure science will be used in determining future plans. The word transparency used a lot by the leaders of this district. However, the word transparent implies that anyone who examines these transparent decisions can easily see how those decisions were made and how the data used supported those decisions. So far, that hasn't been the case. Transparency is using scientifically designed matrix that has been presented to ASD parents and on which they made the decisions for their children. Transparency is using data that is applicable to Anchorage and its citizens, not extracted from cities with more stringent regulations. Transparency is not returning until there is a consistent, steady, long-term decrease in the number of new cases in our community. Transparency is recognizing that if the municipality has declared orders to protect the community, all school district buildings, which are public spaces, should adhere to those same guidelines. Transparency is creating a school return plan that ensures that students are always 6 feet apart and doesn't allow for students to spend any time together with their masks off, as in lunch. Transparency is providing quality, solid surface barriers for all schools, not expecting teachers to construct them from laminate and PVC pipes. Transparency is ensuring that there are enough ASD educators available to safely and consistently teach classes. Transparency is not just hearing, but listening to educators when they share their concerns. We are not being silent, and we are not accepting dangerous decisions. Please keep this in mind when making the decision regarding our students' future safety and education. Thank you.
Thank you. Next up, speaker number 41, Tanya Reed. Tanya, are you with us tonight?
I am.
We can hear you. You have 2 minutes and the floor is yours.
Thank you very much. I, like many parents, do want schools to open, but I also want to make sure that they are open safely. Until tonight, hearing the board members asking really good questions, I had little confidence in the school board. I've listened to the last 2 board meetings, and for the first time, I feel that this is finally being taken seriously. I appreciate the great and constructive questions from some of the board members. I have looked at my own immersion elementary school plans, and I do have full confidence in the principals, teachers, and staff to do the best they can with what they have. But the first thing on my school plan says students will be dropped off, picked up in the lane in front of the schools. Parents will be required to stay in their vehicles. Students must wear masks. 3 staff members will be assigned to this area to assist vehicles and enforce social distancing. What about staging pickups and drop-offs by grade level? How are schools with lottery programs, which have much higher zone exemptions and have a higher than normal drop-off rate, going to deal with this? Have any of you ever driven down Jewel Lake at 8:45 or 3:15? Not allowing parents to park and walk their kids in will not just double the traffic in the area. Is ASD going to pay APD to move traffic? I would guess that residents will also be very upset. And on a different note, what about traveling families? Will you require all staff who travel during the school year to quarantine? Will you require students not to travel? And what if they do? These are all questions that I have. If you want to build confidence in the public, I feel you need to be more open. Open the schools for tours to all parents before we're forced to put our kids back in there. Allow parents to submit questions and get direct answers directly from the administration. We all agree that this is ever changing, and I feel that the numbers the administration presents oftentimes need to be put into context. Using terms like less than is disturbing in your data. Thank you.
Thank you so much. Next up, speaker number 42 in person, Kyle Kaiser. Thank you for joining us. You have 2 minutes. The floor is yours, and we have our timer right down there in the front for you. Begin when you're ready.
Perfect. Thank you for having me again. This is the 3rd time I've come to testify about this. I would like to say thank you for delaying in-person start in schools. I hope to see this continue at least through January. Get us through the holidays and through flu season and all that fun stuff, and let's revisit this when hopefully things have calmed down. Just like most things in Alaska, we tend to be behind the curve from the rest of the country, and we're just starting to see a real spike hit. It's on everybody's mind, including our teachers, and I would just like to address that. There's a lot of us in this community that love all the things our teachers and principals are doing for our kids. And for community members and board members to downplay their concerns over their health and safety is absolutely appalling and is uncalled for and should not be present. They have every right to have a concern about going back to school, and they have every right to act how they feel in their own interest and for their safety and well-being of their families as well as themselves. As a parent, I'm very happy to see that my kids are not going back right now. It's not safe. I'm glad to see that this board is recognizing the community impacts that our schools will have. While it's not going to stimulate the economy and create jobs and all the things we all long for, we're going to get there. Right now is not the time. But again, I wanted to say thank you for postponing this. You are hearing us, and that's it.
Thank you. Next up on the telephone, speaker number 43, Celeste Hodge, Grogan, probably. Celeste, are you with us tonight?
I am.
Wonderful. You have 2 minutes and the floor is yours.
Thank you. Good evening, Dr. Bishop and members of the Anchorage School Board. My name is Celeste Hodge Grouden, Alaska Black Caucus President and CEO. Originally, when I learned the superintendent wasn't moving forward with reopening the schools, I thought, great, there's no need for me to testify. However, after rethinking about the need to testify and hearing from many others, I decided to put our position on the record so there's no mistake. The Alaska Black Caucus is opposed to reopening schools while COVID-19 is skyrocketing. For the life of me, I can't understand why in the world this would even be an option. Reopening the schools with alarming rates of COVID-19. What? It absolutely makes no sense. A large concern for me is within the Black and Indigenous people of color community. If our children get infected, they can spread the disease to family members, which include parents and grandparents with pre-existing conditions. As we know, systemic health disparities and social inequities have put people from racial and ethnic groups at increased risk for dying from COVID-19. What I'm sharing may just be talk to those outside of these high-risk community groups, but it registers loud and clear to us. It isn't just, it isn't fair, and it isn't right to risk our health by reopening schools. Teachers and staff should not have to fear their workplace. Parents shouldn't have to fear their kids returning home from school. Thank you, Superintendent Dina Bishop, for recognizing now is not the time. Thank you to our amazing teachers. And I want teachers to know the Alaska Black Caucus stands in solidarity with you on this issue to keep you safe and to ensure the safety and learning of all our children. I also want to share the Alaska Black Caucus is willing to host. Yes.
Celeste, I'm so sorry. Your 2 minutes is up.
Okay, great. Thank you.
Thank you. Next up, speaking in person is speaker number 44, Sarah Price.
Good evening, board members and superintendent. There is an emergency going on, not the one everyone wants to talk about. It is the one where children's necessities are abandoned and our well-being and lives are used as a bargaining chip in this political game. It is the closure of schools in this district that is the true emergency. The emergency the district has cited as justification for neglecting students is a virus that differs from the flu in death rate in Alaska at 0.002%. Now let's talk about the real emergency that by continuing school closure, the district is contributing to. Increased absenteeism, specifically in minorities, disabled, homeless, and economically disadvantaged students. Increased failure rates, something a district who has a 64 and 73% below proficiency rate in language arts and mathematics for high school students cannot really afford. Increased depression and suicidal thoughts. Any student can tell you what they have witnessed ripple through our young community, with even 3 children taking their own lives, with a response of, who knows if this could have been prevented if we were in school. Are these the kinds of chances we want to give our most vulnerable students? And while many try to claim that virtual school is working, the reality for most high school students is staring at computers for upwards of 6 hours a day. Material either dumb that we don't learn or sped up so we cannot possibly learn. We have not seen nor talked to many of our friends in months. Many students eat most of our meals in our rooms. We wake up over and over with no purpose or motivation to try. The majority of us, our parents and teachers who are afraid to speak up because of the teacher unions, desperately want to return. And we have a district that will not create action. This district is not following the science that Dr. Bishop is stating and is not protecting our students nor educating us. I understand you are in a difficult position, but it is time for solutions and to do what we know is right and send us back. Thank you.
Thank you. I'm going to go back up the list. I have 2 speakers that have called in. The first one is speaker number 27, Sarah Reynolds Weston. Sarah, are you with us tonight?
Hi. Hello.
Hi, we can hear you. You have 2 minutes and the floor is yours.
Thank you. Appreciate you looping back to me. And I just want to thank everybody for being on the call, the superintendent and the members of the board. I'm sorry, I haven't been able to prepare formal remarks. I just got off of a long day of work. I have to work extra hours on the weeks that I don't have my son while this crisis goes on so I can make up for the time lost when I have him and making sure that he has access to the education and the online platforms that you all have created, for which I'm very grateful. However, as a single mom of a child who has an IEP, I believe it is really important that you all go ahead and find a way to move forward reopening schools. I understand there is a variety of perspectives, both upsides and downsides to opening versus reopening, and that teachers differ on what to do, families differ on what to do, and even the students differ on what to do. And I realize it's your job to weigh all these factors and decide. That's why I hope that you'll give those of us who want an option to return the ability to do so. I believe you opening up the schools for families and students who depend on our teachers and our special needs teachers assistance and the programs that you all offer for vulnerable communities are very important for certain families. And those of us who need those lifelines are begging you to take this very seriously. And I am grateful for my friends and families that I know who are able to keep their children home if that's what works for them and their families. But for families like mine, this is something that's very important and near and dear to our hearts. And so I don't envy the job that you have through this and how you have to weigh it and factor in all these different considerations. I appreciate you taking the time to hear those of us with these different perspectives. And I look forward to the plan that you're going to roll out when you create an opportunity for us to get these kiddos back into the class, particularly the young kiddos and the kiddos with these special needs who need the IEP assistance that you guys offer so well. So that's all I have to say. Like I said, I don't have formal remarks, but I appreciate your time and consideration.
Thank you so much. Are you Christy? Okay. So next up, a little out of order, but we'll make it work. 46, Christy Rogers. And you have 2 minutes and the floor is yours.
Thank you. These were some questions I had for my principal and they answered no to all of them. Are you aware the head of health in Alaska came out with a statement yesterday? When you get a lot of cases in a short period of time, you can overwhelm the healthcare system quickly and you get lots more excess deaths. And I think that's where we're at a threat of. Answer was no. Are you aware majority of kids who die of coronavirus are Hispanic, Black, and Native Americans? Answer was no. As of October 13th, Anchorage had 57 deaths. 52 were people of color. Are you aware of that local data? The answer was no. Are you aware that out of 52 people of color who died in Anchorage, the majority were Alaska Natives, following up with Asian and Pacific Islanders who tied for second? The answer was no. Are you aware that minorities require more need for hospitalization than whites at higher rates depending on racial group? The answer was no. That was a quite disappointing experience considering licensed professionals should be data-driven in their decision-making process. Here is a chart of hospitalizations for kids of color. The lowest one are the whites. That is the disparity in our decision process of what we are against. The bottom one is from Washington because it actually has Pacific Islanders. So I thought it was good to add because there's such a small group. But Pacific Islanders have the most need of needing hospitalization. So, was that 2 minutes?
Quick, I'm sorry.
Right,
Thank you.
I leave it, but here's one death already.
Thank you. Going back up to speaker number 39, Rihanna Gay. Rihanna, are you with us tonight? I see your hand raised, but *6 to unmute.
Hello, can you hear me?
We sure can. Thank you. You have 2 minutes and the floor is yours.
Greetings, school board. This is Rihanna again coming to you. I want to thank all board members for their efforts of what they do for our students, myself as an educator, and our community. Let me tell you about my district. Our Anchorage School District's foundational model is educating all students for success in life. Life right now looks really different from our past. Believing that consistency is important is key. My district stands up for what is right. My district uses data to make informed decisions. My district keeps its students and its employees safe. My district cares for its community, uses and follows research-based best practices to have success in all areas. My district takes student learning seriously. My district takes me seriously. My district provides me with great technology. Our IT department is fantastic. My district follows the science and listens to experienced, sound doctrine. My district cares for me. They will not put their highly qualified in jeopardy of hazardous working environments. My district provides me with the tools to teach from a safe environment. I have had success online. 2 weeks ago was Red Ribbon Week, in which we shared about drug safety and taken a pledge to be drug-free. Students wore red, had silly hair, etc. to further drive home the message of being drug-free. Last week, my students learned the new sight word this. Learning is slow, but it is happening. My district believes that data must drive our instruction and that we follow what the data tells us to do. My district believes in keeping nearly 50,000 students safe. My district believes that mental health is just as important as academics. My district believes or should believe that all students and staff can get tested and will require a like. My district cares for us and will do the right thing. Thank you.
Thank you. And I believe last up in our list is speaker number 47, Bob Griffin. Bob, are you with us tonight?
Howdy, yeah, this is Bob Griffin. Can you hear me okay?
We sure can. You have 2 minutes and the floor is yours.
Yeah, this is Bob Griffin from the State Board of Education, but I'm representing myself as a local community member. The delay in start of in-person school while other activities are open sends a strong signal to the community that education is a non-essential activity. I hope we can all agree that that's not the case. Recent evidence indicates that the students, many of them are performing poorly with distance delivery. And the kids that are most adversely affected by that are kids that are in at-risk populations that already were posting poor scores prior to COVID-19. The world's a different place than it was originally when our schools closed. Back then, we were seeing 13% of diagnosed cases in Italy, resulting in fatalities. And now the situation has evolved, so should our response. By protecting the vulnerable in Alaska and with much better therapies, we've dramatically reduced our hospitalization rates. The length of our hospitalization stays and our COVID-19 fatality rate has plummeted to 0.5%. These amazing accomplishments have been largely overlooked while we focus on the raw numbers of infections. CDC report pointed out that over 277,000 kids that were tested positive for COVID, 51 of those 250,000 cases tragically resulted in a fatality. And the vast majority of those cases had one or more serious pre-existing medical conditions. For context of those 51 tragic deaths, over 400 school-age kids die from drowning every year, and over 100 die from bicycle accidents. Sweden never closed their primary schools and haven't reported a single fatality among school-age kids. As we continue to protect the vulnerable, we must signal to the community that K-12 education is an essential activity by giving parents the option to bring their kids back who don't have serious health concerns within their daily contact bubble. Most European countries have higher infection rates than ours, yet their schools are open. COVID-19 and risk in Alaska is a risk to school-age kids, but not as much as a risk to their long-term health and education. Okay, thank you.
Thank you. All right, and with that, that brings us to the end of the entire public testimony list. I do believe we have hit everybody. At this time, I just want to acknowledge there is written public testimony also attached through board docs. Hope all board members have had a chance to read it. It is also available for the public to read as well. Next up on our agenda, there was going to be a proposed action item by a board member. I don't anticipate there being one now, but because it is an action item, I have to at least ask the members of the board if any motion is forthcoming. All right, not seeing any. That means there's no action to be taken at this point. And we did go through all of our public testimony, so it is 8:50, and I would entertain a motion to adjourn.
I move that we adjourn.
I got a first and a second. Everybody, thank you for being here tonight. We'll see everybody next Monday.
Thanks, everyone.
Night.